The House will come to order. Motions and resolutions.
Hollins moves that House File number 447 be taken from the table.
I recognize the maker of the motion, the Majority Whip, the member from Hennepin, Representative Hollins.
Can't even understand.
Thank you, Mr. Speaker. Ramsey, actually, but that is my motion.
Representative Hollins moves that House File 477 be taken from the table. All those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. The clerk will report the bill.
House File number 447, an act relating to civil law, the first engrossment.
I recognize the author of the bill, the member from Ramsey, Representative Becker-Finn, to explain the bill.
Thank you, Mr. Speaker. This is the Judiciary Policy Omnibus Bill. It is a very bipartisan bill. I'm going to talk not about every single piece in this bill, but there are a couple things I want to lift up that I think are important. Again, bipartisan work that we've been doing in the Judiciary Committee. As you guys know, we're the data nerds in the Judiciary Committee, and so there are a couple of elements related to that. First, there is a bill that would make sure that students' personal contact information is private data. Right now, in Minnesota statute, the default is that kids' names, home addresses, phone numbers, contact information is public data. We are closing that loophole up so that kids' private information is held safe. There are also some changes around notary publics so that a notary can perform marriages. We also have a Representative Scott bill, a Representative Bliss bill, fixing some technical things from previous work that we've done. And last, I want to lift up, there's a Representative Feist provision that requires that personal injury cases can continue even if the victim passes away, so the survivorship can continue. It's a relatively short bill. I do want to speak to, unfortunately, one of the provisions in this bill has gone off the rails a bit on social media, and so I want to set the record straight. There's a provision in this bill that comes from the Take Pride Act, and it is updating our human rights statutes. Specifically, there's a piece in the bill so the bill updates outdated language that incorrectly ties pedophilia to a person's sexual orientation. Nothing in the bill changes or weakens any of the crimes against children in our criminal statute or the state's ability to prosecute those who break the law. Of course, pedophilia is not a protected class, is not a sexual orientation, which is why the language never should have been in the bill in the first place. And I think the confusion in the public right now really speaks to why it's problematic that this language was in the bill, in our statute to begin with. So I just wanted to note that obviously none of us want to protect people who are trying to harm children. If at any point anyone in committee, when we heard this bill, when we heard the omnibus bill, had asked that we update this language to make folks more comfortable, I would have been happy to do that. I understand there is an amendment coming, and we'll be happy to put that on the bill to make it very clear what our intentions are. So that is the bill, and again, understand there's a couple of amendments.
There is an amendment at the desk. The clerk will report the amendment.
Niska moves to amend House File number 447, the first engrossment. The amendment is coded A5.
I recognize the author of the amendment, the member from Anoka, Representative Niska, to explain the A5 amendment.
Thank you, Mr. Speaker and members. And Representative Becker-Finn, I think this bill, when it came to the committee, was on one of those double-stack committees where I was trying to run between two committees. And so I appreciate the fact that it sounds like we will be able to potentially fix what I think is an actual real potential problem with the bill as it sits now. And my two amendments today actually both tie together a little bit, and they're about the ways in which we as legislators, when we pass a law, when we write different laws in statute or delete laws in statute, words in statute. I was talking to one of the members across the aisle, just as we were walking actually back from the Capitol to the SOB one day, and we were talking about how it's kind of like throwing a rock into a pond, and you don't totally know exactly where all the ripple effects are going to be. And so I appreciate Representative Becker-Finn for being very clear about what the intent of this is, and there's a reason why I didn't offer the amendment to just undo the striking of the language. This amendment takes that concern seriously about that this language is clumsy and misplaced within the sexual orientation definition, and just as a separate section clarifies that so some court down the road doesn't buy somebody's argument down the road that what we were trying to do was something that today I hope we're going to say we're not trying to do, which is we are not trying to create some sort of cause of action or protected class under the Minnesota Human Rights Act for pedophilia. That none of the other categories should be read to create a protected class in that way. And so to try to close that off for that future court case, I hope that we will all strongly make that clear and put this amendment on. And so, Madam Speaker, I hope that we will all support the A5 amendment, and so we can all vote green. I request a roll call.
Representative Niska requests a roll call. Seeing 15 hands, there will be a roll call. Representative Becker-Finn.
Thank you, Madam Speaker, and thank you, Representative Niska. Again, happy to do this. It was never the intention. Never has been a protected class. Should never be a protected class. That's clearly not the intention of anybody in this body. And to what I spoke to in the underlying bill, if anything, this overall bill actually protects our kids. And I think that we can all agree on that. So I would appreciate members supporting the amendment.
Any further discussion? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. There being 126 ayes and 0 nays, the motion prevails. The amendment is adopted. There's an amendment at the desk. The clerk will report the amendment.
Niska moves to amend House File Number 447, the first engrossment as amended. The amendment is coded A4.
Representative Niska.
Thank you, Madam Speaker and members. And this is one of those data geek kinds of amendments. We talk about government data and the Data Practices Act a lot in the Judiciary Committee. And I thought it was important that we all, and I handed out to everyone, because I thought this was very helpful to me to read the Supreme Court opinion in Energy Policy Advocates versus Ellison, which is a decision interpreting what we've written in the Data Practices Act about data for the Office of the Attorney General. And it was a 4-3 decision, and Justice Thiessen, who used to sit up there in that chair, wrote what I thought was really quite an extraordinary dissent in the case about why the majority of the court had gotten this interpretation of this provision incorrect. And so I did offer a bill. We didn't get it heard. I hope we will be able to get that heard next year. Chair Becker-Finn, House File 2480. And I think it's important, though, that we all think about a couple of things about the Energy Policy Advocates bill. First of all, I think it's very helpful for us to read, all of us to read, again, what those ripple effects can be when the courts are trying to interpret words we say and words we don't say, and when we don't say the same words we do say in other sections. Because that was really a big part of, I think, where the majority really latched onto, and they said, they kicked it back over to us and said, hey, legislature, it's your job to try to fix this. I believe they went in the wrong direction, too far towards government secrecy and not respecting, I think, important public interests in transparency. I don't think this should be a partisan issue. This is something I would support even if the Attorney General were a Republican. But I just wanted to raise this in order to raise this issue with the body, and also to kind of help us to understand the point of the other amendment, which is we should be very, very careful and very precise about the words that we use and don't use. And so with that, I don't think it's necessary that we take a vote or a partisan vote on this today. And so, Madam Speaker, I withdraw the A4 amendment.
Representative Niska withdraws the A4 amendment. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File Number 447, as amended.
Third reading as amended. Discussion to the bill. The member from Anoka, Representative Niska.
Sure. Thank you, Madam Speaker and members. There are some good policy provisions in this bill. Definitely some good bipartisan provisions. Most of the provisions in Article 1 I agree with. Representative Scott, I'm sure we'll talk about the technical fix on forfeiture. We fixed, we took a Representative Bliss bill to fix veterans' predatory lending. We fixed the name change process. In Article 6, I think took an important step towards creating a new process for healthcare open discussions. That was a bill that actually was incorporated that I was a co-author on. But there are a couple of provisions in particular that I can't support. And I just want to talk very briefly about one that I think is misguided, especially in our current political moment, which is that the bill takes the Board of Public Defense from currently a board where the majority of the board is appointed by the judicial branch, and now it's a board that the majority of the board is appointed by the governor. And we heard in committee testimony, one public defender that said, we need to make sure that justice is not seen as a partisan thing, it's not seen as a political thing. And I think this is a step in the wrong direction in that regard. And I think that, again, we should be thinking about how we structure our government processes, how we structure our government boards in a way that's neutral to which side wins or loses, whose ox is getting gored. And I think that the changing this provision in the Board of Public Defense is a mistake. I hope we can change it in conference committee and get that taken out so that, again, we put the Board of Public Defense, which is an independent office within the judicial branch, into something where we can trust the leadership is being chosen in a non-political way by the judicial branch. And I appreciate that there is some politics in the judicial branch as well. The governor initially appoints judges and then they run as in elections. They're nonpartisan elections. But if we lose the ability to trust the courts as a neutral, fair body, then we're in a lot of trouble. And so I do think that it's important that we have the Board of Public Defense as a board that is where a majority of the board is chosen by the judicial branch. And for that reason, I am a reluctant no vote on this bill today. I hope we can fix that in conference committee. I appreciate the fact that we did fix what I thought was an important thing to fix in this bill as well. But today I'm a no vote. Thank you.
The member from Anoka, Representative Scott.
Thank you, Madam Speaker. Thank you, Representative Becker-Finn, for a good committee. And I don't have anything new to add to what Representative Niska said. The Board of Public Defense, making it a political body is problematic, and I encourage our members to vote red. And yours, too.
The member from Ramsey, Representative Becker-Finn.
Thank you, Madam Speaker. And just to speak to, the intent was to try to get more members of the public on that board. That's really the goal with the Board of Public Defense. But again, overall, this is a good, mostly bipartisan bill that I think fixes some things a couple of us have been working on for a couple of years in the nerdier space. I can say you withdrew the amendment before I could speak to it, Representative Niska. But I appreciate that for once you referenced a case and gave us copies of the case. I could make you raise your hands, but you and I may be the only people who have read it and will read it. But I can promise you we'll be getting more in the weeds on some data policy stuff throughout the interim and next session in a non-budget year. With that, members, this is a good bill, fixes some things, and we should all vote green. Thank you.
The clerk will take the roll on the bill. The clerk will close the roll. There being 70 ayes and 57 nays, the bill is passed as amended and its title agreed to. The next bill on the calendar for the day is Senate File 2995. The clerk will report the bill.
Senate File Number 2995, number 1 on the calendar for the day, an act relating to state government, Health and Human Services, the unofficial engrossment.
I recognize the author of the bill, the member from Olmsted, Representative Liebling, to the bill.
Thank you very much, Madam Speaker and members. Members, I know we're all tired. It's been a really long day, but I don't want to miss the opportunity to begin by thanking a lot of folks. This is a big bill. It's in any big budget bill is a big project, but as I'm sure many members know, Health and Human Services is an especially big project. First of all, I just want to acknowledge my Vice Chair, Representative Bierman, my Republican lead, Representative Schumacher, and all the members on the committee who have helped this year and been really great partners. I always want to tell Minnesotans, too, that we have incredible public servants working for us here in the House, our nonpartisan staff, and I really want Minnesotans to understand how really valuable they are. And I think if Minnesotans really knew, they would be really proud, as we should be. So I want to acknowledge, first of all, the revisers staff who work really, really hard, and we don't often see them and even know who they are sometimes, but they are incredible. They work so hard. We have Joe Harney, who's the fiscal analyst, who's worked with our committee, who's done great work. And then our House research staff, Elizabeth Clarkvist, Randy Chun, Sarah Sunderman, and Danielle Punelli, who are, those of you who've worked with any of them, I don't have to tell you how great they are. I want to acknowledge our pages. We've had really outstanding pages this year, and they've done a ton of work as they are. And the two I want to speak of are here in the chamber today, Cassie Soar and Khalid Ali, who've just been working so hard for us. Our partisan staff, Joe Durheim, Jonathan Cotter, my LA and our CLA, Krista Niedernhofer, Josh Sandy, my committee administrator, and then I'll leave it to Representative Fisher, when you speak, to talk about the staff who've worked with you as well. I especially want to acknowledge this year the Sergeant's Office, Capitol Security, the State Patrol. We've had a lot of controversy this year. We've had big crowds sometimes in our committee room, and these folks have been really stepping it up and keeping us safe, and we all really so appreciate it. We couldn't do our work without you. And then I also want to acknowledge, of course, the staff in the agencies that work with us, and I'm not going to name them, but they know who they are, and they also do amazing work. So members, the pandemic has taught us many things, and one of the things that it has really taught us is how essential health is to our economy and how interconnected we all are, how much we really depend on each other to be healthy. This bill covers a lot of ground, but I'm going to just sort of list some of the things that it does, and then and I'm not going to be able to name everything, but I do want to just kind of run through. So first of all, very importantly, it invests in reducing disparities so that all Minnesotans can have better opportunities to be healthy. A few of those items, it has funds in it to improve urban Indian health with the help of Representative Keeler. It funds an Office of African American Health and American Indian Health at the Department of Health. It has a Community Solutions for Healthy Child Development, which Representative Bonner championed, cultural and ethnic minority infrastructure grants from Representative Hassan, and we could go on. It invests in public health to help us recover from the last pandemic and prepare for the next one, which we hope will never come. It invests in studying long COVID to learn a little bit more about how to help victims of that illness. And it has money in it for local public health that will help all of our districts be better prepared for whatever public health issues may come forward. It has a big healthcare package which works to fund more affordable and accessible healthcare for Minnesotans. So elements of that package, it deprivatizes our public health care programs, streamlines bureaucracy, and saves money that we now spend on layers of administration instead of actual health care. It reduces barriers to care and covers more Minnesotans, including folks who are undocumented, who will be able to join our Minnesota Care program if they qualify financially. And it has continuous eligibility for children in medical assistance, and it eliminates out-of-pocket costs for the very low-income people who are on our medical assistance program. It works toward a Minnesota Care buy-in to give Minnesotans a better choice in health insurance, something that many folks badly need. And for the very first time, it provides resources to study the way forward in healthcare, including a study of a universal healthcare system, which Representative Reier has worked on very hard. It also invests in our healthcare workforce, which is so critical to health and has been so stressed and so depleted during the pandemic. It has in it the Keeping Nurses at the Bedside Act from Representative Feist, which we'll hear more about in a while. It has in it workplace safety grants, which Representative Wolgamott has championed. It has more funding for EMS from Representative Hewitt. And it has a lot of loan forgiveness for healthcare professionals to help build and maintain our healthcare workforce. A number of other really important items. It has a pharmacy carve-out, which means that we will take our pharmacy program under medical assistance and stop running it through the pharmacy benefit managers that now exist. This is part of the layers of administration I was talking about, and just run it as one program. And you'll hear later why the small pharmacies in all of your districts are clamoring for this because they need it to stay in business. This bill has school-linked mental health grants. It has provisions for lead remediation because, as we have heard from Representative Jordan, no amount of lead is safe. And very importantly, it has provisions to ensure that Minnesotans will have reproductive freedom into the future by repealing a lot of outdated and burdensome provisions. And I know we've got a lot of controversy about that, but those are especially important to many of us. This is a great bill that meets the times we're in and looks to the future. I'm going to sit down now, and I think that Representative Fisher would like to mention some of the mental health provisions that are also in this bill. Thank you, Madam Speaker.
The member from Ramsey, Representative Fisher.
Thank you, Madam Speaker. And members, I will review the Article 7, which is behavioral health. First of all, I do want to say a big thank you to the staff that we had, our nonpartisan staff, Danelle Pinelli, Sarah Suderman, our committee page, Zach Cullen, GOP Reacher, Jonathan Cotter, DFL Research, Spencer Coase, my committee staff, Nick Stumel-Langer and Jared Margulies. In terms of going to the committee members, we've all done a great job. I appreciate the bipartisan work, particularly from Representative Lead Keel and Representative Baker. And this mental health section represents a lot of that bipartisan work. It represents an attempt at providing the next step around behavioral health policy changes across a variety of areas. Updating uniform service standards, ensuring mental health providers are supported in their ability to deliver services, and getting youth the services they need when they need them are all important factors in setting up our comprehensive behavioral health system. We are in a behavioral health crisis across the state of Minnesota, and raising rates to better pay for the needed service expands the capacity of providers across the state to help our kids and adults in need. Highlights of this article include ensuring that certified community behavioral health clinics are better supported and validated in the state of Minnesota, and ensures that we get the most out of a federal program and the federal dollars for them. It modifies regulations, including mental health provider certification and training, rehabilitation services, home specialist qualifications, to recognize the reality of our workforce shortage while maintaining the integrity of programs and ensuring service quality is not impacted. And finally, it makes numerous changes around children's mental health needs that include updating family peer support service qualifications, requires training specific to families and children for mental health crisis service providers, providing for treatment codes that focus on early intervention in children's mental health needs, and ensures aftercare services are provided at residential treatment facilities.
There is an amendment at the desk. The clerk will report the amendment.
Liebling moves to amend Senate File Number 2995, the unofficial engrossment. The amendment is coded A8.
Representative Liebling.
Thank you, Madam Speaker. Madam Speaker, I move to divide the amendment. I would like to divide it after line 10.10, between 10.10 and 10.11.
You checked. Representative Liebling, it is divisible at that point. Representative Liebling.
Thank you, Madam Speaker. I'd like to take the second piece of the amendment first.
Representative Liebling would like to move the second portion of the A8 amendment first. Representative Liebling.
Thank you, Madam Speaker. So the second piece of this amendment, it's really just updates some language that was inadvertently left out. The Kraft bill on network adequacy, we didn't get the most recent version that passed Commerce into the bill, so this is updating that. And the other thing that it's doing is it is just a couple of technical changes really on line 14.27 and 0.28, it's just making clear that there's a one-time appropriation for the SUD, Pregnancy, Health, and SUD Task Force, and then it's just making a change so that the language will match the spreadsheet. So I would ask your support for the second half of the amendment.
Discussion on the second half of the Liebling amendment. Seeing none, all those in favor, please say aye.
Aye.
Those opposed, please say no. The motion prevails. The second portion of the A8 amendment is adopted. Discussion on the first portion of the A8 amendment. Representative Liebling.
Thank you, Madam Speaker. So the first half is what it's intending to do is, again, just update something that's in our bill with the newest language that has passed our committee. However, it was coded to be put in a new section. And because of that, because I know we spent a lot of time on this floor earlier today in a big argument about whether that was germane, and I know there's concern about it. Nothing nefarious was intended for sure. We just were a suggestion from staff to put it in a new section, but didn't think about the germaneness problem. So at this point, I'm going to withdraw the first half of the amendment.
Representative Liebling withdraws the first portion of the A8 amendment. There is an amendment at the desk. The clerk will report the amendment.
Becker moves to amend Senate File Number 2995, the unofficial engrossment. The amendment is coded A19.
The member from Traverse, Representative Becker.
Thank you, Madam Speaker and members. What this amendment does, since 2015, with our ambulance services, especially in greater Minnesota, when that service does not have an EMT or paramedic that can take a 12-hour shift, we are able to work with the next service to cover that shift. Currently in Minnesota statute, you have to have an EMT or paramedic in the back of the ambulance. What my amendment does is it increases that 12-hour one shift to 24 hours. So for like example, with the Browns Valley Ambulance, we have mutual aid agreement with Ortonville, with Graceville, with Wheaton, with Sisseton. So we are able to increase that from 12 hours to 24 hours. And then I worked with the board and we came up with an agreement, no more than 5 shifts in a particular week period. That's 108 hours. This gives more flexibility. These areas are still providing service. We're just working with the next ambulance close by or closest by. Along with that, Representative Hewitt had a great recommendation to then each service would have to report every year how many times they did that, which gives us very important data because we do know we have a workforce crisis. Folks like me aren't getting any younger and so forth. Like Representative Franson said the other day, some of us are getting closer to getting in the nursing home. I'm one of those, but I'm still a lot of speed. So we get that reporting in that's much needed. So this is not a solution to the EMS problem we're having in greater Minnesota. It's a Band-Aid. It gives us time to work across aisle, which we have. Representative Hugh and I have worked over the last 3-4 years on this issue. We have a lot more to do. So I would ask for your support, members.
Discussion to the amendment. The member from Dakota, Representative Hewitt.
Thank you, Madam Speaker, and thank you, Representative Becker, for the amendment. Folks, this is really hard to get up on the floor because, once again, we're talking about the same problem we've had for 5 and longer years. This is to put something in legislation so we can delay response. And it's unfortunate because, like the nursing homes, we have a problem in EMS. We don't have workers, and not only in outstate, but now I'm hearing response problems in Metro. So we have a big problem, but I also want you to know I'm not Debbie Downer here. Sorry if Debbie's in here. I want you to know that Chair Joachim has put really good legislation in her bill that will help us get EMTs in high school. We have Chair Podolsky that also has put things in his bill to get more paramedics out of college. And I cannot tell you the many things that are in Chair Liebling's bill. And I really have to thank them because that's going to help all our counties. Folks, I need to ask you for a green vote on this Becker amendment. Thank you.
Any further discussion on the Becker amendment? Seeing none, all those in favor, please say aye. Those opposed, please say no. The motion prevails. The amendment is adopted. There is an amendment at the desk. The clerk will report the amendment.
Quam moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A10.
The member from Olmsted, Representative Quam, to your amendment.
Thank you, Madam Speaker and members. This is rebasing for critical access hospitals. There are about 1 per county type, over 70. So they're all around the state. The issue is with the critical access hospitals, a greater percentage is at the lower reimbursed rate. And so about 61% have the government insurance programs. And this is just to try and get the reimbursement rate bumped up, rebasing, so we can keep those hospitals going and helping your communities. There is similar language to this. I believe Representative Herr is carrying a bill that has some similar language. So it's not a partisan thing. It's basically, let's do the right thing. And the nice thing is that the federal government reimburses like 90% of a lot of these costs, so it won't be as much of a hit to us to actually do the right thing. Please vote green.
Discussion on the Quam amendment. Representative Liebling.
Thank you, Madam Speaker and Representative Quam. So, it would be great if we could just give everybody all the money they need. That'd be great. And, we did seriously consider this, and just the cost was prohibitive in our bill and with considering the tails that we had. So I'm going to ask members to vote no.
Representative Becker.
Madam Speaker, I do ask for a roll call vote.
Representative Becker requests a roll call. Seeing 15 hands, there will be a roll call. Representative Becker.
Yeah, and basically on this side of the aisle, and then we have Representative Brand and Lissegard on that side of the aisle, we have roughly 70 critical access hospitals in Minnesota. And the challenge that we're facing, in Glenwood, the challenge that we're facing in Wadena, the challenge that we're facing in Wheaton, is these hospitals are running on a percent of less than 1 or 2% margin. And one of the reasons we see that is because right now, government insurance programs continue to grow. And this bill will do that too. But the challenge is when you have a hospital in your rural community in greater Minnesota, that 61% of their patients are government program, and you're running at a 1 or 2% margin, and you increase that, which this bill will, what we're going to see is we're going to see health care access. Again, health care access dwindle. So the response for me as an ambulance personnel, instead of going 25 miles to Wheaton or 30 miles to Ortonville or 20 miles to Sisseton, we may see a point that these in greater Minnesota, we're going to start to have regional centers like Browns Valley ambulance driving to Alexandria more often. So, and the challenge is when you see more government programs, your reimbursement rates are lower. We have seen them in hospitals as low as 27%. You don't have to be a rocket scientist. You can even use your fingers and count that doesn't add up. When you have hospitals in greater Minnesota that are getting by at 1 or 2%, that, and some aren't, and you're going to go and increase the government program to a higher percentage, you're going to lose money. And what that means is if those facilities can't have the staff, and that's already the problem right now. There's several times on a Friday or a Saturday night that I go to the hospital, walk into the ER, and I help out the ER staff, especially if it's a full code, and they're have to pump things in the veins, and I'm helping with CPR, I'm helping with advanced airways, and so forth. So that's the big concern. And plus, the good news is the federal government provides a match for the population of the bill. So every dollar of state funds, the feds will match it. There's a 90% federal match for the Medicaid. So it makes sense because, again, we want to make sure we have good health care access, and that's what this amendment does. I would ask for your support on this amendment. Thank you, members.
Representative Quam.
Thank you, Madam Speaker. And people, I didn't want to get into a bunch of numbers and stuff. To me, it boils down critical access. The name says it. We've got we've got hospitals close to us here. In the metro, you've got access, you've got options. You get greater Minnesota, and if you lose something, your next option could be longer than the person will survive to get there. Now, a lot of things, we say, well, trade off on money. Frankly, 10%, 10 cents on the dollar to be able to fill this. Because once these fail and close, they're gone. You're not going to be able to get a new hospital there. We had an amendment earlier going over consolidation and merger and et cetera. That's a huge thing happening, and it's a concern. We need to do the right thing, critical access. If you've got about 2/3 of the people on government programs, you know that a lot of the patients are low income. These are not rich people living on estates. These are hardworking, low-income people needing medical care and needing it in their area. So please vote green. Thank you.
Seeing no further debate, the clerk will take the roll on the amendment. Members, please vote. The clerk will close the roll. There being 56 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Schumacher moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A23.
The member from Rock, Representative Schumacher.
Thank you, Madam Speaker and members. The A23 amendment deletes the portions of the bills that are relating to the mandates on nurse staffing in hospitals, namely those mandates that take nurses away from the bedside to put them on staffing committees, workload committees, and the mandated arbitration. This amendment removes the legislated staffing mandates, which include the hospital core staffing plans proposal, which includes the language, the maximum number of patients on each inpatient care unit for whom the direct care nurse can typically safely care. This sets a cap based on the number of patients and the number of nurses. Call it what you would. This ignores the individual needs of the patient. This ignores the skills and the experiences of the nurses, yet it is a mandate in this bill to our hospitals. The amendment pulls out language on a daily staffing schedule that requires, quote, the actual number of patients assigned to each direct care registered nurse present and providing care in the unit. Hospitals already report how many patients are assigned to each nurse after the fact, but this language also requires hospitals to forecast the actual number of patients. And hospitals, by their nature, don't know what type of services they'll be needing from day to day or for how many patients. This requires an actual number of patients, and the mandated staffing decisions can go to arbitration. This moves the decision on hospital staffing mandates to a board outside of the hospital. This delays the decisions that are made, and it impacts patient care. What's interesting is that CMS already requires that hospitals adjust their staffing daily. The chief nursing officer is federally responsible for all staffing within the hospital, and then that cannot be superseded by a committee, as this bill would attempt to do. The chief nursing officers also have constant contact with their nursing teams. There's frequent huddles to make immediate decisions. Patient census and acuity can change quickly, and this is prevented from taking a patient assignment in this bill, along with the charge nurse and other managerial nurses who would no longer be allowed to take patient assignments from this. If we do not adopt the A23 amendment and this language becomes law, the mandated staffing committee will have the ability to reject patients to the floor by no criteria but personal desire. The arbitration process will halt a hospital's ability to adjust to changes, leading to closing wings and backing up emergency rooms. And in Greater Minnesota, where distances between hospitals is measured in half-hour increments, we risk a lot to put nurses on a committee. Members, please vote green.
Discussion to the Schumacher amendment. The member from Ramsey, Representative Feist.
Thank you, Madam Speaker. I rise to oppose this amendment. This would cut out the heart of the Keeping Nurses at the Bedside Act. This bill is a response to the fact that oftentimes when nurses express concern about unsafe staffing levels, they are told things like, we'll pray for you, or we're sending you a pizza. This is not acceptable. It's not acceptable for patients in Minnesota, and it's not acceptable for our nurses. This bill is a comprehensive bill to empower nurses to address unsafe staffing, to address factors that lead to workplace violence in the hospital setting, and to make investments to train, recruit, and retain nurses at the bedside. Many hospitals and nurses that I have spoken with have told stories of hospitals in crisis. They've talked about long waits at ER for admission. They've talked about patient exams and rehabilitation happening in hallways due to short staffing. They've talked about regular physical assaults in hospitals on nurses and staff due to unsafe staffing. And they've talked about readmission shortly after discharge because of holes in care and holes in providing instructions to patients as they are discharged. Nurses are leaving bedside at the large numbers, citing in surveys the biggest concern is unsafe staffing by a very wide margin. The status quo is unsustainable, and we need to bring nurses back to the bedside, and this is the bill to do it. There is no shortage of skilled, licensed, registered nurses in the state of Minnesota. A recent survey showed that 130,000 registered nurses are in Minnesota today. That is an increase of 8,000 from last year. There is no shortage of nurses in Minnesota. There's a shortage of nurses who are willing to work at the bedside under current conditions. This is not a new issue caused by the pandemic. It is a decades-long nationwide trend that has been addressed through similar legislation in other states and is being considered at the federal level. In addition, this is not a new bill. It has been around since 2008, and it has evolved over time from a strict ratios bill, such as the one we've seen in California and recently in Oregon, to a more, a bill that creates committee structures that already exist in hospitals and can work within structures that do already exist. I've spoken with so many chief nurse officers and chief executive officers, CMOs, with the hospital association over the course of this session, and those conversations have been incredibly productive. Over the course of this session, this bill has evolved, and it has become a very workable model for safe staffing here in Minnesota. Notably, this bill is moving in tandem with other bills, the healthcare bill, the human services bill. We are finding ways to support hospitals and support nurses in myriad ways through legislation that is moving this session. Bottom line, this is a well thought out bill to address the unsustainable status quo when it comes to trends around hospital staffing. Minnesota's hospitals, nurses, and most importantly, patients are looking to us to do something. And if we amend this bill out, we are telling nurses that we are not going to stand by you and we are not going to do anything. And I'm not willing to do that. So I would urge members to vote no. Thank you.
The member from Rock.
Thank you, Madam Speaker. And as I begin, I would request a roll call.
Representative Schumacher requests a roll call. Seeing 15 hands, there will be a roll call. Representative Schumacher.
Thank you, Madam Speaker. And to continue on with this, I do have a few concerns that came as well from the fiscal note. When we look at some of the pieces that are updated now in the fiscal note with the direct care and treatment, the state expects to have 20 people on these committees meeting weekly for an hour during the first 2 months of this rollout. And the relieving nurses will have to be paid overtime costs to maintain the staffing levels. So if we're trying to work to get nurses to enjoy their work more, I think giving them overtime is probably the first thing to really help with that. We also see from the fiscal note that the arbitration is going to come at quite a cost for any facility that enters with that. It's estimating $2,000 per day in arbitration, and then to close out the arbitration is another additional $1,000. And that's from what we have in the fiscal note for the facilities that are state-run. If you extrapolate that to the other facilities throughout the state, that's going to come to a great cost to our overall healthcare system. In fact, the Massachusetts Health Policy Commission, when they looked at not only the arbitration costs, but the costs of everything else that they're doing in Massachusetts there, they were projecting in their state additional costs to the healthcare system of between $676 million and $949 million. All of which contribute to longer lines in emergency rooms and for the chance that a nurse is just going to reject you when you come in and ask for care. The state price tag involves just the 8 hospitals that are in the state running there, but every hospital across the state is going to have to deal with that. And for those 19 hospitals that are owned by local units of government, that is going to be put back on the backs of the local taxpayers as well. When we talk about the number of nurses who are registered in the state and that we have plenty, the number of 130,000 was put out there. I have the nursing workforce data report that is a little old. It's from April of 2023, but it shows 122,000 11,000 of whom are double counted in there. There is, that number is noted as being inflated in this because of the number of nurses who were verified during strikes to come into the state, and the 8,700 who came in from that, and those who requested to work in other states in Minnesota, the 11,500 from there. And so we do have a nursing shortage in this state. You can look at the editorials that were passed around here as well. And for those reasons, Madam Speaker, I would ask for a green vote.
The member from Candy, Ohio, Representative Baker.
And thank you, members. Madam Speaker, again. And thanks, Representative Schumacher, for bringing this amendment to us. I absolutely support this amendment. I was looking at the same report that was, it's not even a month old, that's talking about the nurses and what's in town and what's in the state and what's available. There is a tremendous shortage of workers, especially in the healthcare field. I mean, I don't know where, Representative Feist, who you're talking to or where. It is not accurate information that you are getting. Here's what is good, though. If you want to keep hiring more out-of-state nurses and more traveling nurses, they fill up our hotel rooms, which is good for me. But that's horrible for our healthcare system. That is not what we should be doing. Putting this kind of legislation in place is a really bad idea from a workforce standpoint. Again, I mentioned there's actually a human shortage here, and in this report, it clearly identifies that. Nursing is hard work. It's 24/7 in a lot of operations. Nurses have been able to make choices whether they want to work from a clinic standpoint, if it's a 9 to 5, if it's from home health care, they want to travel to people's homes and residences. There's all kinds of different kinds of nursing today, too. But this bill creates mandatory committees, staffing by arbitration, posting on staffing plans, and hospital report cards. These mandates cost hospitals far too much money and will implement a plan that will pull nurses from patient care. I'm just really doubtful that these activities that you're trying to put forward will draw nurses back into the nursing field. If you look at what they've done the last couple of years, they're starting to come back for a couple of real big reasons. Number one, they're actually paying nurses better today than they were a year or two ago. And the second big reason is COVID is just about nearly gone, which devastated the industry for a lot of different reasons as well. We have, the report also will show you, we are going to have a tremendous work shortage. In 7 years, they're predicting a $50,000 workforce shortage in the healthcare field. 50,000 shortages. That's insane to me. So members, this is a really good amendment. We have to do a better job. Our hospitals are barely making it the way it is. The more restrictions and more business mandates you're putting on them, we can't raise the money fast enough in reimbursements for the system to support this bill. So please, members, support the Schumacher amendment tonight. We don't have the people to do something like this. Please support the Schumacher amendment. Thank you.
The member from St. Louis, Representative Scraba.
Thank you, Madam Speaker. Thank you, Representative Schumacher, for the bill. When you said it's more like a half hour to a hospital in northeastern Minnesota, it's more like 2 hours from Grand Marais to Duluth. Or from Ely to Duluth, it's an hour. Or International Falls to Duluth, it's 2 hours. There was a great article in the Duluth News Tribune, and they talk about with more than 5,000 nurse openings in Minnesota right now, and an already alarming number that is expected to leap to 43,000 in 7 years. Meeting nurse-to-patient ratios dictated by St. Paul would be a challenge. The Minnesota Hospital Association estimates that patient capacity would need to be reduced by 15% if this proposed law is passed this session. That would mean 70,000 Minnesotans a year unable to access the care they need as a result of the poorly named Keeping Nurses at the Bedside Act. Right now, how it works is an ambulance comes in, and an ambulance with a patient and the nurse leader and the nurse manager and the charge nurse, they all talk about real time what to do, and then they make it happen. Under this bill, they would have to meet as a committee earlier. It doesn't work. It's not going to work. Another great objection that the folks have is a group sitting on the committee do not agree or do not want to take more patients, then it goes to arbitration. Patient care is 24/7. We know that. We are a critical hospital. Grand Marais, Ely, Big Fork, Cook, International Falls. These are all towns that, we have 6, 7 nurses, maybe 8 nurses, and we're having a hard time keeping those nurses there. Right now, we have traveling nurses to make things work. And they are not cheap. They're very expensive. And it's hard on our communities. This is only going to make it worse. Please vote green. Thank you.
Any further discussion on the amendment? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. There being 58 ayes and 67 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Schumacher moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A13-1.
The member from Rock, Representative Schumacher.
Thank you, Madam Speaker. And members, the A13 amendment places the drug benefits back in the managed care organizations. Originally, we were told that this carve-out would be used to help rural pharmacies, but this language was changed in Ways and Means, and now it's just going into the state coffers. At this point, it's a lot like the preferred drug list that was put into law in 2017. That was created to draw out rebates, and maybe that's what it does, but it doesn't show up in budgets. It just gets buried in admin. We have no sunlight on that. And what's more is that this triggers a rule which will eliminate the 340B participation for hospitals. The long and short to what that means is the net effect of over $85 million leaving our hospitals. But it's not all hospitals that are dealing with that. It's the hospitals that deal with the disproportionate share of difficult and high utilizing patients. If you think hospitals deserve to keep those federal funds, please vote green.
Discussion to the amendment. Representative Liebling.
Thank you, Madam Speaker. I'm so glad to rise to talk about this carve-out program. So, first of all, I just want to sort of maybe explain, I think what Representative Schumacher was just talking about taking funds out of the bill, et cetera, is not really accurate, but I do understand it would be a little hard to follow. So this is a program that your small pharmacies are desperate for us to pass. Let me just explain that right now, under our medical assistance program, about 85% of our patients are under managed care organizations. Every one of those managed care organizations hires a pharmacy benefit manager to manage their pharmacy benefit. And these pharmacy benefit managers really put the screws to our small pharmacies. So under our fee-for-service program, where the state is running the program, there's an amount that is paid that is based on a cost study of what it costs to actually dispense a prescription, which is right now $10.77 per prescription just for the dispensing. The managed care organizations pay whatever they want, and what we heard, the testimony we heard in committee is that they're paying pennies. Now, everybody who's tried to work in this space around drug costs understands one thing, and that is this is a very, very complicated space. It's complicated because the drug manufacturers, the pharmacy benefit managers, or PBMs as everybody calls them, really they just keep pointing fingers at each other. They're responsible for the increases in costs, et cetera. But we know the pharmacies, the small pharmacies in particular, are telling us that they are getting the short end of the stick. And they actually came to me, I carried this bill before, but they came to me this year. That's why I carried it again, because they asked me to do it. Pharmacies are closing all over the state, and I think the file was House File 1752, and I believe that Representative Davids is a co-author on it. He came over to me and asked to be on it because of his pharmacies came to him. So this is a really critical issue. Now, it is very complicated. So in the bill, one of the things about this program is it's going to take a while for it to actually get going. It's not going to be effective for 2.5 years at the earliest because of some systems work that has to be done at the Department of Human Services. And during those 2.5 years, I was really concerned that those small pharmacies are going to go out of business. So initially, I tried to put some money in the bill to pay them extra in the meantime. But it turned out that I didn't do it the right way. And so they asked me to remove it because what I did unknowingly, and because it's so complicated, it was going to be worse for them than what I was trying to do to help them. So they said, don't do this. It's better to take it out than have that in. So that is why I took some money out of there, Representative Schumacher, because we didn't do it the right way, and we're still going to try and see if we can do better when we get to conference. So I just wanted to explain that. So this is a critical piece. Now, I want to address this thing that seems very technical called 340B, which is very technical, and but this is how I would explain it. And this is something I hope all members kind of start to learn about because it's really important. So this is a federal program, and it's something that I gather very few people actually understand. It's kind of a little bit out of control program, and Congress, I think, wrestles with how to reform it. But in the meantime, what it actually is doing is it is providing kind of a hidden subsidy from our tax dollars through this drug program, through the managed care organizations to some hospitals and other outpatient pharmacies in the state. And so whenever you try to reform this program and you try to say, let's get the PBMs out of our public programs, let's stop giving the middlemen a bunch of money and a bunch of power that they are using to destroy our pharmacies. We want to get them out of our program. And so what do we have to do? We have to find some money to hold harmless these organizations that are getting this money, that's hidden subsidy. But it's really hard to know how much they're getting. That's how really difficult this program is. So there is money in the bill to try to hold harmless these organizations, and it's something that's really hard to do. So it's a little bit of a work in progress, but we're not going to, this thing doesn't become effective for 2.5 years at least. So there is time to try to figure this out. Obviously, none of us wants to just pull money away from organizations that need it, that are doing good work. On the other hand, I don't know about you, but I want to know where our tax dollars are going. I want to know that what we are funding, not have the money flow by the back door to organizations where we don't know where it's going or how much. So I really would like everyone to think hard about this. Also, I had asked for and I think it went around, there's an editorial that's on your desks. That is an editorial written by some of these small pharmacy advocates that explains this pretty well. They are begging us to do this. So I ask members, if you care about your small pharmacies, especially those of you from rural areas, they are asking for this, so please vote no on the A13-1.
Representative Schumacher.
Thank you, Madam Speaker, and thank you, Representative Liebling, for that explanation for that. I think at least half of that I agreed with, and just how foggy this all can be. But at the end of the day, there's still a lot that's at stake for our hospitals, especially those who are receiving this funding. And you have hospitals like Centricare, Regions Hospital, North Memorial, Essentia, Fairview, Gillette Children's. All of them receive these 340B payments. And so I'm happy to hear that this is still a work in progress overall. I would note, too, there was the comment that was made that we're trying to get the PBMs out of the public programs. However, DHS uses a PBM called Magellan for their programs, so we wouldn't completely get rid of them in this. Please vote green.
Representative Liebling.
Madam Speaker, I'd like a roll call.
Representative Liebling requests a roll call. Seeing 15 hands, there will be a roll call. Seeing no further discussion, the clerk will take the roll on the amendment. Members, please vote. The clerk will close the roll. There being 55 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Schumacher moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A14.
The member from Rock, Representative Schumacher.
Thank you, Madam Speaker. And members, this amendment removes the uncertainty to our health insurance system by deleting the language that establishes the Minnesota Care system as a public option. When we heard this bill in committee, the Republicans conceded that given the political winds and the power control that's in the state right now, that this was probably an inevitability. But we asked several questions in committee and really made the point that instead of just going ahead with the proposal as it was in the moment, that we should look at the study and just continue the study as we could to see how this works. There's always next year to actually implement it if the study tells us and gives us the answers that we want to know. Even though we philosophically disagree with public option approach overall, we know that if this law gets passed, that will affect our constituents as well. We continue to have questions that cannot be answered without a proper study. Some of those questions include, what will premiums under Minnesota Care public option look like? Will they be similar between the buy-in and commercial plans? If it will be lower, how will it be lowered? How will those lower premiums be accomplished? Through paying less to hospitals or through more state subsidy? If hospitals have to do cost shifts, to what extent will they be allowed to do so? Also, another question on the process, using the state's basic health program, unlike any other state, granted it's an innovative idea, but our constituents are going to expect this to happen if it passes this way, and we don't know yet if the federal government will even allow this idea to be implemented. Commercial insurance has been held to a different standard when it comes to coverage mandates. Do we know how constituents are going to be informed if they lose their mandated coverage now by switching to the public option? We simply ask these questions to tap the brakes to better understand the impacts to our constituents, to hospitals and clinics, and to the private insurance market. We ask to have the brakes tapped, but instead, you hit the accelerator. The effective date for this public option is January 1st of 2027. In committee, Leader Long described his plan to be stood up and run through the health plans. But on that same day, the managed care systems are to be eliminated in this state. So I guess the question could be asked, what will the public option be run through on January 2nd? There are a lot of changes and assumptions to this proposal. The fiscal note assumes an 18.6% shift annually to the public option from the individual market. but that assumes that reinsurance is still in effect, and tomorrow's bill, we're going to hear that that gets defunded a lot sooner than we were originally anticipating. So again, the information that we do have on the bill is not accurate, and there are more questions than we have answers. The answers that we do have just aren't accurate. And Madam Speaker, I would ask for a roll call.
Representative Schumacher requests a roll call. Seeing 15 hands, there will be a roll call. Discussion to the amendment. The member from Hennepin, Representative Long.
Thank you, Madam Speaker. I would ask members to oppose the amendment. Minnesota Care has been a successful program for 30 years in Minnesota. This would allow more Minnesotans to participate and buy in and would reduce uninsurance and underinsurance. Thank you.
Any further discussion on the amendment? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. There being 57 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Murphy moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A12.
The member from Otter Tail, Representative Murphy.
Thank you, Madam Speaker, and thank you, members. This is an amendment that removes the background study fee increase. We have record surpluses right now. There's no need to add more fees to this. In addition, there's a $2 increase that goes to the pockets of the DHS. Most problematic portion of this provision is putting the fee increase on autopilot, so it automatically increases as other fees increase. We need to know the workers need a DHS background study. We know they need it. It's a serious problem, but the fee increase won't solve that problem. So I recommend a yes vote on A12.
Representative Liebling.
Thank you, Madam Speaker and members. I would ask for a no vote on this amendment. Members, DHS is supposed to charge users for this service. It's a $2 increase per background study. This is a very important service. This is what keeps people safe. We want to make sure that we get background studies for people who are going to be working with vulnerable people. And it's a really modest increase. It doesn't go in their pockets. It pays for the service. If people who are using the service don't pay for it, the taxpayer is paying for it. So I think it's very fair. The so-called automatic increase is that DHS has to pay the BCA and the FBI for their part of the service, and when those fees go up, DHS then has had to come back to the legislature to ask for a $2 or whatever increase just to keep up with that cost that they have to pay. It's just a pass-through to pay for the fingerprinting part of the background study. So this is a service government provides. The fees should cover it. I ask for a no vote.
Any further discussion on the Murphy amendment? Representative Murphy.
You know, this is just common sense. It's a record surplus. We need to help out the workers and not just the DHS. So majority, this is a time that you can totally redeem yourself. So it would be a really good chance to encourage you to vote yes.
All those in favor of the Murphy amendment, please say aye. Those opposed, please say no. The motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Schultz moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A2-1.
The member from Morrison, Representative Schultz, to your amendment.
Thank you, Madam Speaker and members. This amendment simply seeks to restrict dollars from our state government going to medical assistance for people who are here illegally in Minnesota. This bill allows, currently, the majority has decided that this bill should allow for those who live in the state of Minnesota illegally to receive medical assistance, to receive welfare benefits in Minnesota. This isn't the policy that we should be pursuing in our state. It's not legal currently, but this bill would make it so. And so my amendment seeks to strip out that language because, members, we need to be good fiscal stewards of the dollars that we have. We have a limited amount of dollars, and when I think about the struggles that Minnesotans are actually facing right now, I'm thinking about the discussion that we've had about mental health tonight and how the dollars that are currently in this bill are going to be pushed towards those people who are here in this state illegally. Those dollars could be used for those people who are in need of mental health treatment in our state. I'm thinking about members. I'm thinking about the need that we have for our nursing homes in this state and how the majority party in Minnesota has failed to fund our nursing homes and how we could be helping them if we weren't pursuing a policy in Minnesota like this bill does that provides for medical assistance and welfare benefits to those who are in our state illegally. So that's my amendment, members, and I would ask for a roll call.
Representative Schultz requests a roll call. Seeing 15 hands, there will be a roll call. There is an amendment to the amendment. The clerk will report the amendment.
Quam moves to amend the Schultz amendment to Senate File Number 2995, the unofficial engrossment as amended. The amendment to the amendment is coded A26.
The member from Olmsted, Representative Quam.
Thank you, Madam Speaker and members. And I actually had a debate of what it would be. Would it be dental care, which we are not funding well, especially in greater Minnesota for access for low-income people? Would it be mental health for adolescents? And I chose to have this drafted to give the money to nursing homes, which we've had a lot of debate on that. Our spending is priorities. I say our priority should be for legal Minnesota residents and for the people that help make this state what it is, to keep our nursing homes open. Please vote green.
Discussion on the Quam amendment.
Point of order, Madam Speaker.
Representative Tabke, please state your point of order.
Speaker Hortman, under House Rules 3.21, motions and propositions must be germane, and this amendment to the amendment dramatically expands the scope of the underlying amendment.
Representative Tabke rises to a point of order under the germaneness rule that applies to amendments. I've had an opportunity to review the amendment to the amendment, the underlying amendment, and I find the point of order is well taken. We are on the Schultz underlying amendment. Any discussion on the Schultz underlying amendment? The member from Hennepin, Representative Agbaje.
Thank you, Madam Speaker. I would recommend a no vote on this amendment. The main purpose of this provision, which is known as the Minnesota Care Immigrant Inclusion Act, is to expand Minnesota Care to our undocumented neighbors in Minnesota. It would also allow those who qualify under the current income requirements to become eligible for Minnesota Care. Currently, undocumented immigrants are only able to access emergency health care that is costly to our healthcare system and does nothing to address chronic or non-emergency health issues that could lead to detrimental long-term effects like hospitalization or death. Because of our current healthcare system, undocumented members of our community delay seeing a doctor until the situation is dire. And by that time, they're often at an advanced stage of illness and need costly interventions to address their issue. If instead they had had access to health care, cancers could be caught earlier, chronic diseases could be managed better, and mental health needs could also be addressed. Members, health is wealth, and by including this provision in this bill, we are saying that Minnesota can be a place where you can make a living, build a family, and take care of your health. Undocumented immigrants already pay their share of taxes, paying up to $108 million in state and local taxes in 2018. And 69% of our undocumented workers work in our most vulnerable and essential jobs. like agriculture, meat packing, grocery, manufacturing, janitorial, cleaning services, security, and construction. And yet, despite their taxes and sacrifices, many of them do not get to partake in any of the benefits for themselves or their families. And that is simply unfair. Undocumented immigrants are members of our community, part of our workforce, and Minnesotans. They deserve access to health care, and I'm glad that this bill does that. Members, vote no on the amendment.
The member from Olmsted, Representative Quam.
Thank you, Madam Speaker, and I need to correct a misstatement that was just made. In my district, for years, we have had clinic, preventative care, exams, vaccinations, and et cetera for immigrant workers. And I know that they do not card at the door. They're helping the people in the community. I'm not sure about the other districts in the state, but we have it down in my district, and I don't think it's bad to expect that other districts have the community involvement and the help. This is about the short budget that the chair has spoken about, and that we don't have money for this, we don't have money for that. That means you put priorities. And this amendment by Representative Schultz is putting the priority on Minnesotans, legal residents of Minnesota. Thank you.
Any further discussion to the amendment? Representative Liebling.
Thank you, Madam Speaker. And I just, this is just prompted by the last comment there. I just want to say that one of the things that really is a problem for a lot of our hospitals, especially I would say our critical access hospitals, is when people come in who are uninsured. Those people need charity care. So allowing people to be covered with insurance, and we're talking here about people who are financially eligible. In other words, they're under 200% of the federal poverty level. If they can have insurance, that helps your rural hospitals. So vote no on the amendment.
Representative Schultz.
Thank you, Madam Speaker and members, for the debate and the discussion on this issue tonight. And I appreciate Representative Quam's great attempt to try and get this body to support our nursing homes. But alas, it continues to be rejected in this body. Not even sure why the member who rose to a point of order would have wanted to do that. Could have been a benefit in that community. Kind of shocking. But members, this debate is about being in accordance with federal law. Passing this bill tonight, as it's currently written, could place Minnesota's medical assistance program in jeopardy because it is currently against the law on the federal level to spend federal dollars to provide for people who live in Minnesota illegally, to provide these sorts of benefits for them. And so for us to be pursuing this policy sets us on a dangerous precedent for the nation. Not only to say that these are resources that we have a very finite amount of in our state, and we need to focus our direction in this state on those who need it most. And frankly, I'm thinking about those who are in a nursing home and they're not being funded during this session, and we could be helping them out. But instead, members, over the coming few years, actually in the next biennium, there's a projection that providing these sorts of benefits to people who are in this state illegally would cost the state of Minnesota $101 million just in the next biennium when this actually would take effect. And so, members, that's my concern. It's about the fiscal stewardship of the state. It's about making sure that we aren't incentivizing more people to travel to our state illegally and benefit from a program when people in this state who go to work every day don't want to see their tax dollars used for someone who is here benefiting from medical assistance, but they came here illegally. And they are here illegally, members, breaking the law, breaking federal law, and putting our medical assistance program at risk, members. Vote green on this amendment. Let's support strong fiscal stewardship and be in alignment with federal law.
The clerk will take the roll on the amendment. Members, please vote. The clerk will close the roll. There being 56 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Scott moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A7.
The member from Anoka, Representative Scott.
Thank you, Madam Speaker. And before I get started with the amendment, would the bill's author yield to a question?
She will yield. Representative Scott.
Thank you, Madam Speaker. Representative Liebling, I am going to draw your attention to page 185.2 and 3 of the bill. And I don't remember this language being in the Judiciary Committee when it came to the Judiciary Committee. And I'm just wondering if that was added in Health Committee after it had been to Judiciary. It talks about Section 1304, Subdivision 2 of the Data Practices Act. Do you happen to recall?
Representative Liebling.
Thank you, Madam Speaker. Representative Scott, I'm not finding what you're pointing to here, if you could repeat. But I have to say that, to my understanding, this was a separate bill. This was part of the Department of Health's, if you're referring to the underlying bill here that was carried by Representative Carroll, this was part of the Minnesota Department of Health's policy agenda, and we did not modify it. So if I'm not finding where you're pointing to me in the large bill here, but you could ask Representative Carroll. It's his bill, but I am pretty sure that it was not modified and that it is as it went to committee.
Representative Scott.
Thank you, Madam Speaker. All right, so I think I've got an answer to my question. So I'll go ahead and talk about the amendment. Members, I don't know if you knew this or not, but Minnesota has this thing called the Minnesota Health Records Act. And it requires a healthcare entity to get consent from a patient annually to have their information shared. And I was not aware that this cancer surveillance system didn't apply. They exempted themselves from the Health Records Act and getting patient consent to have their very sensitive healthcare information shared through this surveillance system. And so what the underlying bill does is it says that the current law says that instead a physician can give consent to have a patient's information shared in this data sharing database. And the bill's correction this year that Representative Carroll carried removed even that physician's consent. So it just said they had to notify the physician. And so what my amendment does is it requires, like the Minnesota Health Records Act does, to get the patient's consent before it's shared into this database. It's not just a statewide database, but it's shared for research and other uses that the patient doesn't even know about. We heard stories of patients being called on the phone and being asked questions about their cancer treatments while they're home trying to recover from treatments. And the patient is like, well, where did you get my information? And well, they got it from the researchers, and the people that were calling them got the information, the patient's information, from this cancer surveillance system. So I think we need to get this right. I think we need to get the patient's consent in each and every case. So I would ask for a green vote.
Discussion to the Scott Amendment. Representative Carroll.
Thank you, Madam Speaker, and thank you, Representative Scott. I appreciate your concerns. You know, you and I talked about this before committee and in committee. You and I share the same goal of patient protection and data privacy. This bill does that. In fact, it's treated as private data, and if anything is improperly disclosed, it's subject to criminal penalties. I believe there are the protections that you seek.
Representative Scott.
Thank you, Madam Speaker. And Representative Carroll, you're right, we did discuss about it. And I'm not sure we share the same goal or not, because consent is a vital piece of data sharing when it comes especially to Minnesotans' health care records. I think I'd like to request a roll call on this amendment.
Representative Scott requests a roll call. Seeing 15 hands, there will be a roll call. Any further discussion to the amendment? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. There being 57 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Schumacher moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A4-2.
The member from Rock, Representative Schumacher.
Thank you, Madam Speaker. And members, this amendment is a removal of the language that deals with the Healthcare Affordability Council. There are some concerns that have been raised with me and others about this council, particularly when it deals with the composition of the board and just how that is set up and who gets to make the appointments. The underlying bill requires that this commission establishes healthcare spending growth targets. Setting growth targets can set a dangerous precedent and could have profound negative impacts on the care delivery that providers are supposed to do, especially if they don't meet with the board's bureaucratic ideas of healthcare growth targets. There are concerns from older citizen groups and people with disabilities on just how their care may be put through in this Healthcare Affordability Council. And we really don't want to go down this path of trying to make decisions on people's behalf based on numbers that don't take the particular individuals in mind. And so for that reason, members, I would ask for a roll call and ask for your support.
Representative Schumacher requests a roll call. Seeing 15 hands, there will be a roll call. The member from Dakota, Representative Breyer.
Thank you, Madam Speaker. Thank you, Representative Schumacher. Members, I'm going to request a no vote on this amendment. This is a very good and very useful program to pursue. We know that healthcare costs are rising in Minnesota, other states, and the nation as a whole, but we do not have the information to make wise decisions about how to change it. So what the program does is it does in fact establish growth targets, but it does it using information and tying it to the economic growth rate of the state as a whole. So it's not an arbitrary, non-data driven change. It then identifies strategies to reduce drivers of administrative spending and low value care, building a more efficient system. And then finally, explores opportunities to adopt advanced payment systems in rural areas, focusing on ways to strengthen the rural healthcare system, which we know needs investment and new ideas. So for those reasons, I request a no vote.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 57 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Schumacher moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A21.
The member from Rock, Representative Schumacher.
Thank you, Madam Speaker and members. The A21 amendment really tries to tap the brakes, like we talked about before, on some of the proposals that have been moving forward. It's interesting. We see studies being included in this bill, but also the implementation and the enactment dates and when these are going to be official. So we're going to study them just before we actually put them in place. No matter what we find in the study, we would have those already put into place and put into law. And so we make adjustments to that. We also require notifications on the program that allows for the opt-out of managed care. That notification must be given to people who want to opt out of managed care for fee-for-service to let them know of any differences between the services they had been getting under managed care versus the services and what they'll be getting from fee-for-service, which include things like transportation, pharmacy, interpreters, and care coordination services, because managed care, as part of what they operate to do in order to lower the cost of health care in this state and across the country, is providing services like transportation, interpreters, and things along the way for that. It's one of the things that people who switch to fee-for-service will have to deal with if we go to a state where we eliminate managed care completely. It'll be entirely fee-for-service, and people should know what they're losing in that process overall. There's also a study that is included in here then to continue this conversation and continue the actual study portions of how we want to take the way we pay for healthcare policy in this state and really look at the differences between fee-for-service and managed care and how that turns out. Now, I have seen the studies that come out of Wisconsin and out of Texas over the last couple of years on this very thing, and I think it's going to show that there are savings when we use the managed care process, plus happier consumers. But I do think that this amendment would be better suited for discussion in conference committee, and I'm concerned that a House position today may taint that ability, and so, Madam Speaker, I reluctantly will withdraw this amendment.
Representative Schumacher withdraws the A21 amendment. There is an amendment at the desk. The clerk will report the amendment.
Davis moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A24.
The member from Crow Wing, Representative Davis.
Thank you, Madam Speaker. Members, the A24 amendment is really an amendment of compassion and care in the highest regards. The amendment simply ensures that Minnesotans receiving care from a healthcare provider, that they have the fundamental right to a support person by their side in the case that they find themselves sick in the hospital or in an end-of-life situation or a potential end-of-life situation. I authored a similar bill this session called the No Patient Left Alone Act, and I was unsuccessful in getting a hearing for that, but that's okay. I'm excited to bring this before the entire body for a vote. I believe that we would all agree that it's a fundamental right to not have to die alone in a hospital. In the last few years, we actually saw this happen, unfortunately. Support persons were denied access to their very sick or dying loved ones, and that was very traumatizing for a lot of folks. I won't, in presenting this amendment, give you examples, but I do have a couple examples that I could share with you. Now, the healthcare providers had difficult decisions to make very quickly. That's understandable. But we're now out of the woods on that whole situation, and hindsight is 20/20, and we always learn by looking back.
Please take your conversations off of the House floor. Representative Davis.
Thank you, Madam Speaker. And I know this is I would hope, very dear to all of us. I will say there's a lot of common sense exemptions and restrictions that go along with the amendment that you can read. I won't go through those either unless asked to. But as a state legislature, we have an obligation to make sure that we're protecting patient rights. Please vote green in support of the 824 amendment. Thank you, members.
There is.
And I would ask for a roll call vote.
Representative Davis requests a roll call. Seeing 15 hands, there will be a roll call. There is an amendment to the amendment. The clerk will report the amendment.
Schumacher moves to amend the Davis Amendment to Senate File Number 2995, the unofficial engrossment as amended. The amendment to the amendment is coded A25.
Member from Rock, Representative Schumacher.
Thank you, Madam Speaker, and I promise that the quarter that was stuck in me is almost out. The amendment to the amendment is actually originally Representative News, just to get it into the form that she had intended to discuss this piece. This proposal was brought forward in the Health Committee earlier this year, and we got feedback that there were concerns with some of the language, and so this amendment is an attempt to address those concerns. It deletes the language that would have allowed healthcare facilities to prevent access to a support person based on vaccination status. It removes the penalties and liabilities to healthcare provider. Madam Speaker, this is an earnest attempt to try and find a little bit of agreement on this so that we can get this through, and I would ask for your support.
Discussion to the amendment. Representative Herr.
Madam Speaker, this amendment is actually a good amendment, and I would ask that our members vote yes for this particular amendment.
All those in favor of the, is there a roll call request on the amendment to the amendment? All those in favor of the amendment to the amendment, please say aye. Those opposed, please say no. The motion prevails. The amendment to the amendment is adopted. On the underlying amendment, Representative Herr.
Madam Speaker, I would ask that the members of this body vote no on this amendment. If you look at the language, it is actually expanded greatly, and it expands into vaccinations, but also it says that it creates a civil penalty for violation of this, and that it does expand the scope of this greatly, and I'd ask for the members to vote no on this amendment.
Further discussion on the 824 amendment. Seeing none, Representative Davis.
Thank you, Madam Speaker. That's very disappointing, especially when I brought a baby on the House floor tonight, folks. Come on. No, I am disappointed. This is a really good amendment. Would Representative Liebling yield for a question?
She will yield. Representative Davis.
Representative Liebling, would you be willing to continue to work on this proposal with us so that we could get this into law?
Representative Liebling.
Thank you, Madam Speaker, and Representative Davis. One of the concerns I have about this, even though it has been, some of the worst parts of it, from my point of view, have been now amended out of the main amendment. I think this is one that we do want to at least talk to hospitals and see if it's workable. I mean, it may be. And, I certainly am sympathetic to the underlying sentiment of this. I'll tell you, when I'm in the hospital, I want somebody there with me. And I think that's a very reasonable desire. But I think it's a matter of how practical it really is. I don't think here on the House floor we should be doing this without any sort of discussion. And so, yeah, absolutely. I'm certainly open to discussion on something like this.
Representative Davis.
Thank you, Representative Liebling. Again, I'm very disappointed. We should all have the fundamental right to have it guaranteed that we have someone by our bedside if we are dying in the hospital. And members, please vote compassionately here. Vote green.
Any further discussion on the amendment? Seeing none, the clerk will take the roll on the amendment. The clerk will close the roll. There being 58 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Scott moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A15.
The member from Anoka, Representative Scott.
Thank you, Madam Speaker. Members, the A15 deletes the changes in this bill to the Infant Born Alive Protection Act. These changes remove the reference to abortion and applies to any infant born alive. That's what the new language in this bill does, concerningly. And it removes language requiring preserving the life and health of the infant that is born alive. So basically, the new language says that any infant born alive, the new language says then now must just have care offered to it. And I just don't know what the definition of care is in this instance. Is it palliative care? Is it life-saving care? Why remove the language requiring preserving life and health? Would the author of the bill please yield for a question, Madam Speaker?
She will yield. Representative Scott.
Thank you, Madam Speaker. And Representative Liebling, I wonder if you could answer that question for me. Why the changes to the Infant Born Alive Protection Act? Why remove the references to abortion so that it applies to any infant that's born alive? And why remove the language requiring preserving life and health of the infant?
Representative Liebling.
Thank you, Madam Speaker, and thank you, Representative Scott, for that question. So this provision of law is, I think, based on false claims. This is in law, and it's being now pushed even more states around the country. And by the way, I think Montana just turned down a similar law. But it's based on a false idea, the really false idea that people pregnant or wait until late in pregnancy to have an abortion without any real good reason, that it's sort of a frivolous thing, that people carry pregnancies until late and then sort of for no good reason decide that they want to terminate the pregnancy. And that's just plain old false. So these laws that were passed really, I would say, to make abortion more difficult and more expensive, and to demonize doctors, to give the false impression that anyone delivers a child alive and then just lets it die. That just doesn't happen. That's not how abortion care works. And if you look carefully at the definition in the law right now of what a born-alive infant is, it doesn't even really refer to infants that are aborted or attempted aborted. It talks about any infant born alive, and it defines it, having a pulsing cord or certain things. So the end result of this kind of a law, of this law, is to infringe on people who are delivering a child who often has some kind of fatal defect, or there's a really tragic situation. And the impact of this law is to make doctors worry that instead of allowing parents in that situation to have a few moments of comfort with their child, who may have only a few moments to live or a few hours, that they have to intervene and give aggressive care to keep that infant alive, whether or not the parents want that. And one could even really say that sometimes this unwanted and futile care could even be, inflicting pain on that infant for no good reason. So the language that is in the bill now, so we are removing this Born Alive Infant Act from the law, and what we have put in the bill is what I would call comfort language, because we've received a lot of statements of misinformation. There's a lot of misunderstanding of what we're doing. Removing the Born Alive, so-called Born Alive Infant Act from the law does not legalize infanticide, as has been alleged. That is ridiculous. Physicians have ethical obligations to patients. And when an infant is born alive, every physician that I ever have met, and I've met quite a few, would do the ethical thing and give the care that is warranted to that patient, just as they would to any other patient. And so there is comfort language in the bill now that simply states what I believe is obvious, and that is that under Minnesota law, that an infant that is born alive is a person, is entitled to the same kind of care as any other person that is commensurate with good medical practice, that is commensurate with the wishes of the parents who are there with the infant. So that if you have an infant, so that if you give birth preterm or to an infant that has some kind of devastating defect, instead of that infant being ripped out of your arms because politicians have decided that that is what should happen and that there should be significant interventions and that infant should be taken away and intubated and whatever politicians might think would be a good thing to do, that it should be between the parents and the doctor, and that is an element of privacy, and that people in these very tragic situations deserve that privacy. And that is why we need to take this out of the law, because it interferes with that. But obviously, clearly, an infant that is born alive is a person, has a right to care that is appropriate given the situation that they are in, just like every other patient would have.
Representative Scott.
Madam Speaker, I'd first of all like to ask for a roll call on this amendment.
Representative Scott requests a roll call. Seeing 15 hands, there will be a roll call. Representative Scott.
Thank you, Madam Speaker. And Representative Liebling, so we had testimony when this bill came to judiciary. There was written testimony from a NICU nurse, and she was talking about a patient that had cancer. The mom had cancer, and she was advised to have an abortion, a later term abortion. I believe the baby was around 20 weeks, if I recall correctly, and I meant to save the testimony, and I apologize for not having it here. But this nurse, the baby was born alive and breathing, and this nurse was instructed to let the child pass away. And because nobody else was around, this nurse took it upon herself to hold that baby, but she was not allowed to give it any care, any medical care. And so I'm wondering if this is one of the circumstances that you're talking about where you might consider it appropriate, as you said, appropriate care. Was that baby given appropriate care in that situation under the terms of the new language of this bill?
Representative Liebling.
Thank you, Madam Speaker. Well, Representative Scott, I don't know if that actually occurred, and I don't know if it actually occurred under current law here in Minnesota. But if it did, then clearly the current law didn't make any impact to it. But here's what I would say, though, that without this piece of legislation, physicians still have ethical rules, that malpractice laws still apply, that hospitals still have licenses that they have to maintain, and that there's a whole host of regulations that protect patients and that try to ensure good care. And those same rules apply whether this Born Alive piece of legislation is in law or not.
Representative Scott.
Thank you, Madam Speaker. And I'd like to remind members, I know we have a lot of new members on both sides of the aisle in this body, but this bill passed with wide bipartisan support a few years ago. And because of the Supreme Court ruling handing the issue of abortion over to the states, suddenly everybody seems to be just kind of okay with getting rid of a law that was, of course, it was passed hoping that there would be very few cases that this would apply to, but nonetheless, applying to cases where an infant does survive abortions. And Representative Liebling, I remember in judiciary this year, I did ask you, in your opinion, when a baby becomes a human. And your basic answer was when the mom wants the baby. And I just want to make sure that's not what we're doing here. When you say appropriate care, that the baby should be given appropriate care. Because that baby, whether that baby lives or dies, that is not up to a human being, another human being, to decide that. In my opinion, that baby should be treated and given life-saving care regardless of what the maladies that it may be born with. And so I just have a lot of discomfort with the removal of especially the words requiring preserving life and health care. And I feel like just using the word to offer care is very vague. And members, I just don't think that that is good policy making. It leaves too many questions open, and I would encourage a green vote on the A15.
The member from Traverse, Representative Becker.
Thank you, Madam Speakers and members. I'd like to, first of all, go back to August 15th, 2021. Saturday morning at 3 a.m. Now, at that time, I was been on for 26 years. Pager goes off. You don't get too excited after 26 years. But the pager went off. Mother, crisis pregnancy, having problems with the birth. Having problems. Let's just share with you that my pulse went sky high. At 3 a.m., I'm sleeping pretty good. From my house to our garage, 5 blocks. 80 miles per hour, I had my car up to. Thank God I had someone else coming to help me, so now we have 3 individuals. We raced out, literally raced out, in the back of the ambulance, ready to rock and roll, do what we can. I was nervous. I don't get too nervous about runs. Quite frankly, folks, I was scared. I was scared. I've worked with pregnancies, but not a crisis pregnancy. Anyways, I've been in that house once before, walked in, I saw it on Dad's face. Dad was scared too, and Mom was scared also. So we were all scared. I just didn't tell them that, because they called me for help. So Kayla, who was helping me, and Matt, they were awesome. I said, oh, we need this, we need this, we need this. The challenge is I found out doing my interview with her, asking questions, she was 21 weeks pregnant, and that next Monday she was going to be put in the hospital full time. So we got her in the rig. She's crying. We calmed her down, gave her oxygen, and then Caleb and I was in the back. And folks, that was the longest run. I just want to let you know, that was the longest run I've ever been on, and Matt, who was driving it, was driving as fast as he could, reasonable. We gave birth, she gave birth, in the back of the rig, 21 weeks. Folks, that infant, which I call Baby Z, right here, was no bigger than my hand, no bigger. He was no bigger. I did everything humanly possible, everything to save that infant, everything. And that infant was the same outside of the mom as inside the mom. Same fingers, same eyes, same hands. That was my most difficult run. We got to the hospital, you're as professional, you're focused, and afterwards, Caleb and I and Matt, we lost it. Now let me tell you another story. From DHS, this is their report. In 2021, there was 5 babies that was born alive. You read the report. They gave those infants so-called comfort care. If I gave that infant, when it was born in the back of the rig, comfort care only, I would have been charged with murder. Folks, what are we talking about? Comfort care only? Those 5 infants. Comfort care means lay on something hard surface, maybe a blanket. Comfort care is not medical life-saving care. Those infants, yes, infants, humans, have the same right that all of us in here. Any of you would call 911? And you know, quite frankly, I have, since I've been here, have responded to 8 runs at the Capitol. And people expect me to do the best that I can. I and Caleb and Matt did the best we could to save baby Z. Later on, we got a stork pin, and I just put it in a drawer. It was that difficult to run. The thing that I'm so concerned about, so challenged about, actually upset, is those 5 infants in 2021 who was just laying there, comfort care. That is what it says in the report. That is wrong. That's not wrong just because I'm an EMS person. That's what I'm called to do. It's wrong for all of us to even allow us to put up with that. These infants, we had a little child here, two and a half months on the floor today. They can survive. So we're not talking about someone who goes full term. Mine, baby Z, was 21 weeks. This amendment is right. What we're looking to do and moving forward with what's in this bill is wrong. It's shameful, members. Support this amendment. Thank you, Representative Scott.
The member from Hennepin, Representative Elkins.
Thank you, Madam Speaker. Members, late-term abortion at 24 weeks or later is extremely rare in Minnesota. There were only 5 in all of 2021, and there were no abortions after 28 weeks. These abortions are invariably related to conditions threatening the life of the mother, such as an ectopic pregnancy, or fetal abnormalities incompatible with the life outside the womb, such as anencephaly, a serious birth defect in which a baby is born without parts of the brain and skull. When a woman has carried a pregnancy to its halfway point at 20 weeks, it is always with the hope and expectation that it will be carried to term, and the decision to end such a pregnancy is always excruciatingly painful. When a mother has given birth to a child who has hours to live, the last thing that she wants to have is for that child to be whisked away to the neonatal intensive care unit for a futile attempt to save its life. And that is true whether that birth is induced at 20 weeks or carried to term at 39 weeks. She wants to spend those last few hours with her child so that she can grieve in peace. The face of late-term abortion is a woman named Deborah Dorbert, a Florida woman whose case was profiled in a recent Washington Post story that was reprinted in the Star Tribune. Mrs. Dorbert's unborn baby was diagnosed with Potter syndrome at 23 weeks. Potter syndrome is caused by a failure to develop kidneys, resulting in the lack of amniotic fluid, resulting in turn in the underdevelopment of the baby's lungs and other organs. Whether the baby is delivered at 24 weeks or 39 weeks, the outcome is always the same. The child suffocates within hours. Members, what is the point of requiring a woman like Mrs. Dorbert to carry her baby to term? Please read her story, which has been distributed to you as a handout. As described in the story, Florida law was intended to provide an exception to the prohibition against late-term abortion in cases such as hers. However, the law was so poorly written that no doctor or hospital would touch her case for fear of being prosecuted. The lesson for us members is that the regulation of these rare, highly complex, and deeply personal tragedies is simply not amenable to legislation. Broad brush attempts to do so, such as Minnesota's Born Alive Act, result in the cruel treatment of suffering women and their families without actually saving any lives. Members, please vote no on this amendment.
The member from Goodhue, Representative Altendorf.
Thank you, Madam Speaker and members. Today I'm rising. I'm very confused what we're doing here in Minnesota. We have gone from a state that abortion was legal, prior to this legislative session, Then we put our number one priority to become the most extreme state on abortion. And now we're taking it a step further and we're removing the rights of a baby that could be born alive. It's confusing. I think it's confusing to Minnesotans as well. In 2015, the Born Alive Act was passed with bipartisan support. It was signed by a Democrat governor, Governor Dayton. What happened in Minnesota in just 8 years? What happened to this legislative body? This week on Facebook, I saw a post of a dog that was severely burned, and they celebrated saving this animal. What happened, Minnesota, that we celebrate an animal, a pet, more than we would celebrate saving a baby's life? In my district, I'm proud that we have the Eagle Center in Wabasha, and there is a Bald Eagle Protection Act. Did you know that if you harm a bald eagle's egg, if you just harm it, if you take it out of the nest, you will be charged $100,000. $100,000, members. And yet, here in this body, we are ignoring the rights and the protections of babies. The Born Alive Act was passed with bipartisan support. We have heard loud and clear from Minnesota, from Democrats, yes, from Democrats, that they do not support third-term abortions, and they do not support repealing this act. Thank you, Representative Scott, for presenting this amendment. Please vote yes.
The member from Washington, Representative Anderson.
Thank you, Madam Chair. I've heard a lot of, in the abortion discussion, ectopic pregnancies keep coming up, and I just want to, for those that don't know what that is exactly, they don't occur at 24 weeks. Ectopic pregnancies are within the first few weeks of a pregnancy. I've had 2 ectopic pregnancies. It's when a fertilized egg actually fertilizes within the fallopian tube. And so that requires surgery. That's a medical issue. Ectopic pregnancies aren't abortions. When we are not talking about ectopic pregnancies in 24 weeks or in 21 weeks. So and that's been an excuse used by the other side on a lot of this abortion legislation. So I just want to clarify that and clear the air on that. I'm very supportive of this amendment. This was done bipartisan. We passed a bill. If a baby is born alive, that baby has every right that anyone else, any other human has. And just because it maybe was born during an abortion doesn't make it any different than a baby that's born early or born naturally. So we have to really think about what we're doing. We are saying that it's okay if the mother of the child wanted to abort her child. It's okay to let that child die if it's not already dead with the abortion. And that's just wrong. And I think it violates everything about our humanity. So I would ask that we support this amendment. Thank you.
Further discussion on the amendment. Representative Scott.
Thank you, Madam Speaker, and thank you for the discussion, folks. I'm wondering if Representative Richardson would yield to a question.
Representative Richardson is not on the floor. Representative Scott.
Oh, okay. All right. I was going to ask her a question about what they do at Planned Parenthood when a baby's born alive. Representative Liebling, I just, before I ask you one last question, oh, Representative Liebling's gone too. Oh, no, there she is. I'm sorry.
She's just short, Representative Scott.
She's shrinking.
Representative Scott.
We're all shrinking, Representative Liebling. I've lost an inch so far, so it happens to everyone. Members, the language change in this bill is stunning. This language now applies to all babies born alive. Every single one. Every single one. And the language that has been substituted doesn't require life-giving care to be given to that infant. So I'm going to ask Representative Liebling another time. If any infant is born alive, is born under your language in this bill, does that baby receive life-saving care?
Representative Liebling.
Thank you, Madam Speaker. I'm thinking maybe I should stand on a chair here. So, Representative Scott, whether life-saving care is warranted really depends on the situation. Just like at the end of life, there might be a situation where someone is terminally ill, or maybe there's a very bad accident and the chance of someone surviving is so low that maybe the family decides not to proceed. I mean, there are a lot of situations. Every situation is unique. And the issue here is that what care should be provided should not be decided by you or by me. It should be decided by the people most closely involved, namely the person who just gave birth and their family and whoever they choose to rely on in the most difficult situations that people face. Minnesotans do not want us, the politicians, deciding what should happen in these very intense, very personal, and very tragic situations. Whether there should be life-saving care, well, if the infant maybe in an extreme example is going to die within 10 minutes without, and in the doctor's opinion there's no way to save it, should the parents not be allowed to say, let us hold our child, don't whisk it away and stick a tube down its throat? I would say, yeah, that's their call to make, not yours and not mine. So should life-saving care be delivered? That is a question for the patient's parents and the doctors. And I don't think that we can make that in law. That puts us between those parents and the care that they decide is warranted for their child. And I think that's wrong.
Representative Scott.
Thank you, Madam Speaker. Representative Liebling, so you had said something about, a devastating defect, and I don't know exactly what you mean by that, but what we don't want to happen over here, and why we're concerned about the language, is we don't want a child that is born with a clubfoot or some other birth defect that is not a life-saving defect to be not given medical care that would save that child's life, simply because it has that defect. And this language is not clear that that should happen. And so, members, again, this is really squishy language, and I think also if you compare this to end of life, some of us have these directives for end of life, and we're an adult and we're making that decision. The baby is unable to make the decision for itself. So, members, please vote green on this amendment that reinstates this language that protects those infants that are born alive. Vote green.
Seeing no further discussion, the clerk will take the roll on the amendment. The clerk will close the roll. There being 59 ayes and 67 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Scott moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A16.
The member from Anoka, Representative Scott. That's good.
Thank you, Madam Speaker. You know, a lot has been talked about this session. We've all heard it in our committees about grants and nonprofits receiving grant dollars. And I just want to read to you one of the things that one of these grant recipients would need for the Positive Alternatives Grant Program to qualify for one of those. And just tell you a little bit about what the Positive Alternatives Grant Program offers to its clients: medical care, nutrition services, housing assistance, adoption services, education and employment assistance, including services that support continuation and completion of high school, child care assistance, parenting education, and related support services. And the grant services activities, I just want to give you a little bit of data on Positive Alternatives again, because what my amendment does is continue the funding for Positive Alternatives. And so in December 2020, 32,171 women received 400,626 separate grant-funded services. 1,739 women attended car seat safety education and/or were provided a car seat. 2,620 women received infant sleep safety education. 1,747 women who did not have a crib were provided a safe crib for their infants. 1,624 women received shaken baby prevention education, and 1,527 women received child abuse prevention information. Members, this is really worthwhile stuff. I know a lot has been said, and our health department does this a lot. Other entities offer some of these safe services. And we've done a lot of research on infant mortality and mother mortality. And a lot of that comes down to, is the mother getting the prenatal care she needs so that she stays healthy and the baby stays healthy? That's what these grants go towards, okay? This is what these grants go toward, folks. And I just wanted to read, if I can find in my mess here. I wanted to read some testimonials from some women that have received the benefits from these grants.
Members, please take your conversations off of the House floor or into the retiring room or the alcoves. Representative Scott.
Thank you, Madam Speaker. This is from Christina, and I won't give you her last name. I'm a single mom with 3 kids, a 16-year-old, an 8-year-old, and a 4-year-old. I have utilized Life Connections, that's the name of this grant recipient, with all of them. Throughout the years, unexpected circumstances have happened at various times, one being a stroke. Without the amazing support, I would have been evicted, so she would have lost her housing if it was not for this program, not had diapers or a way to transport my kids. I also have done many classes and have learned so many useful and helpful things. I have also found comfort with being not perfect and not judged by the many volunteers who have helped me. They have directed and guided me to places I couldn't have considered. Also, they have helped me connect with others like myself. Without life connections, I can honestly say the many struggles throughout the years could have been very tragic. So that was from Christina. Here's another one from Rebecca. I was scared, alone, and inexperienced when it came to being a mom. Life Connection helped me gain competence and confidence with the following resources: a car seat plus education, gas cards, Mom Talk, which is a mom support group, and diapers. I now just had my 1-year anniversary at my part-time job, am in the middle of a medical coding program and improving my son and my lives, is how she says it. I still get assistance from Positive Alternative grant funds through Life Connections. I would be disappointed to see the grant funds decreased or given to other organizations. I live in Alexandria. I moved to Alexandria with my 6-month-old son, escaping a domestic violence situation, and was on welfare. Life Connections helped us with a car seat and unforeseen circumstances like illness, gas cards, Mom Talk, and diapers. Boy, we better get rid of these programs, huh? These are really, really, really harmful to women and babies. Let's just throw the towel out on these. Members, this is a good program. These are life-saving and life-altering programs that give the clients a lot of great information and a lot of great resources and help them do things like get out of domestic violence, do things like keep them from being evicted from their housing, do things like get them car seats, gas cards, those sorts of things. Have them be part of a support group so they can share with other like-minded women. Members, this is a good program. Please support the amendment. And Madam Speaker, I ask for a roll call.
Representative Scott requests a roll call. Seeing 15 hands, there will be a roll call. Discussion on the Scott amendment. The member from St. Louis, Representative Olson.
Thank you, Madam Speaker. And I would request a no vote on the Scott amendment for a couple of reasons. One, in order to the repeal of the repeal in this bill would have a cost to provide the ongoing funding to the these crisis pregnancy centers, and it takes money from the central office, which is intentionally funded in this bill. So for that reason, and also for everything that was listed by Representative Scott, I've been working on legislation this year to reform the Positive Alternatives Pregnancy Program, and in such, I have also learned that there are places where a lot of what was mentioned can be found. But more importantly, the reason why these aren't funded currently is because we need to have some work to do. There's currently a consumer protection alert issued in Minnesota by the Attorney General because what is happening at these crisis pregnancy centers. And so for that reason, we need to take a serious look about what is and isn't happening within these crisis pregnancy centers before we continue to put state funding into this program. So I ask for a no vote on the A16 amendment.
The member from Mauer, Representative Mueller.
Thank you, Madam Speaker, and thank you, members, for this discussion, and thank you, Representative Scott, for this amendment. So thank you, Representative Olson, for the explanation of why you are voting no on this amendment. This is, of course, something that we have heard as we are talking to members in our community about the consumer protection alert that these facilities are deceptive, that they offer duplicative resources, and therefore it has to be repealed. In rural Minnesota, we have we take care of each other, and this type of entity is often a lifeline for our mothers who are struggling. In Austin, I have one crisis pregnancy center who has they continue to show the necessity of continuing this program. Because as they started in a small house, maybe open twice a week for about a couple hours, has now blossomed and boomed to getting a much bigger facility, open every day. They have clients who are asking for more resources and more services. I went and talked to the person who the person who runs the Crisis Pregnancy Center. Why is my brain not working today? And I just asked her, can you just give me a rundown? I have personally volunteered here. My husband was on the board there for a little while, and we are intimately involved in what is happening. And she wrote to me and said, for sure, I'd love to tell you all the things that we're doing. In 22, we helped over 200 families gain access to basic necessities such as clothing, food, diapers, formula, and more. We handed out over 58,000 diapers and over 300 cans of emergency formula, as well as almost 10,000 articles of clothing, and that is in 1 year. The clients we serve are all under the federal poverty level, most well under being unemployed, and we are a lifeline for them. We help them find other resources in communities such as housing assistance, food shelves, daycare, education, jobs. Over 75% of our clients are refugees. Our clients range from age of 14 to 54, come from all backgrounds, economic, education, religion, etc., and we do not discriminate against anyone who comes to seek our help. We are asking you to reconsider this. The information that you have put out that had this consumer protection alert, this is not information that is, if you find a solitary case of a fine, but what I'm telling you is that it is not what we are seeing as a general description of these crisis pregnancy centers. They offer a valuable and vital service, especially in rural Minnesota, that need the community to be involved and make sure that they come around them and say, we support you and your decision to choose life. No one is forced to, no one is tricked to. They've made the decision themselves, and they've come to these places and asked for help. And our community surrounds these people and surrounds this organization and says, there is a value here. There is a value that we see. And having this grant is a way for them to continue to offer more services, parenting classes, and other things that are of value to our community. I don't know how else to describe how important this is and how vital it is to our community and how wrong these accusations are. I ask that you would vote green on the Scott Amendment so that we can continue to do the work that our community has asked us to do. Let us be a lifeline to our citizens, to our constituents that are having services that are important to them and actually making a difference. Focused money that is going directly to the community and doing work that is vital. Please vote green.
The member from Wright, Representative McDonald.
Madam Speaker, members, Representative Olson, there is indeed a cost to everything that we do here at the House, but for many years, this particular appropriation has helped so many. Representative Scott pointed it out already, but it also helps fathers to connect with their children, especially their sons. And I know each and every one of you know how important it is for fathers and sons to be in each other's lives and to learn how to be a good father and to raise that young lad to be a good person. This appropriation, this money has funded this for many years and done so much good. I remember when we got elected in 2011-12, we took the majority, the Republicans had the majority in the Senate for the first time in 50 years. And this House had with 31 new members, Republicans. And we were gung-ho. We wanted to come in and defund taxpayer-funded abortions that we've heard so much about in our districts, that we care about so deeply to defund that. And I remember Representative Abler, I was on the HHS, and he said, well, Governor Dayton was elected, so it would never happen anyway. He said, don't do that. It won't happen anyway. But what will happen then is that we could lose positive alternatives. Many of us didn't know what it was. I didn't know what it was at the time. So 13 years ago, he educated me on the goodness that positive alternatives did for mothers and children and fathers as well. And we were like a rain of horses. He had to hold us back with all his might and convince us that we should just leave it alone at this point. It was not a battle that we should fight, because the positive alternatives was so poignant and touched so many important lives and mothers and fathers and children that we should be left well enough alone. And here it is 13 years later, and you just can't help yourself to take that away, knowing how important it is. With a $20 billion surplus, or 17.6, it's actually $20 billion without inflation, that it's about money, Representative Olson, that you can't help mothers and fathers of these children, knowing the good that it does. Yeah, Representative Scott, thank you so much for bringing this up. We talked about this earlier this week as well, and it is a passion for us to speak on and to protect. I think we all know the results. You folks, Representative Liebling is bent on just taking it out completely. There are other programs, but not the positive results that positive alternatives bring. So Minnesotans, we will cater to your goodness, and our nonprofit groups, our Christian Judeo faiths, those who believe in a higher calling to do the right thing. We will fundraise, I guess, since you are bent on taking this money out and helping parents and children. We will not give up the fight tonight. You may win this battle tonight. Representative Scott, I'm afraid these folks don't care about the positive alternatives, because there's supposedly other programs that don't do as good as this one do. So you think you'll win this tonight? You won't. Our churches, our nonprofit groups, are those who care about these folks. We will win this in the end. So don't be discouraged, folks. They're not going to win this tonight. They won't. God always wins in the end. We know that. Amen? Amen. And we will help the mothers, the fathers, the children, that you're going to strip this money away that does so much good, from car seats to diapers to you name it. But you're not going to win this tonight. Yeah, Representative, you're not going to win this tonight. Goodness will win in the end. Support this and go vote green. That's all I have to say about it.
The member from Douglas, Representative Franzen.
Thank you, Mr. Speaker and members. Representative McDonald, you're absolutely right. They may win this tonight, but in the end, our churches and our communities always come together. In my current district, I have 2 pregnancy crisis centers, one of which Representative Scott mentioned, which is Life Connections. The other is Options for Women in Sauk Center. Members, have any of you ever gone to one of the Pregnancy Crisis Center's annual banquet? It is the most beautiful event that you could go to. You've got people of all ages gathered for the purpose of raising funds to help families in need and to support pregnant women and the children. There's prayer, there's a meal, there is a speaker that comes and talks. And that common goal, as I said, is to raise money to support women and their unborn baby and their family. I encourage you, they are usually held in the fall. I encourage you, when you get that invite, to attend. It doesn't mean you have to donate any money, but go out of curiosity to see exactly what a lie it is to say that these organizations peddle misinformation. The consumer action alert that the Attorney General put out is nothing but a political hit job. A simple Google search on Google, defunding pregnancy crisis centers, you will get some really interesting headlines. A headline from ProPublica, not a conservative news source. Minnesota looks to a new approach to crisis pregnancy centers. While other states move to defund crisis pregnancy centers, Minnesota may allow to renew their state grants, but with conditions. I guess the condition is right now we're just going to defund them. NPR News, as we know, NPR is definitely not a conservative news source. Minnesota, seen as abortion haven, still funds, and there's a quote, crisis pregnancy centers, as if funding pregnancy crisis centers is a ghastly use of taxpayer funding. Still funds crisis pregnancy centers. The horror, members, the horror of tax dollars being used to support pregnant women, their unborn child, and any possible children that woman may have. Racket MN. I don't know what Racket MN is, but I bet they're not friends of the Republicans. What will the DFL do with funding for crisis pregnancy centers? Ooh, with its trifecta, lock on power, the DFL could defund the grants funneling cash to the controversial anti-abortion faux clinics. That was February 28, 2023. Definitely not a fan of the Republican Party or conservatives, but certainly a fan of propagating a lie. MinnPost. Why did the community protest against a new crisis pregnancy center? Oh, so Democrats can protest pregnancy crisis centers, but Republicans and conservatives and Christians cannot stand outside an abortion clinic to pray. The hypocrisy. Oof, CNN.com. The crisis pregnancy center next door. How taxpayer funded, yada yada, anti-abortion centers raking in taxpayer funds. More than a dozen states use taxpayer money to fund crisis pregnancy centers. I mean, for real. The AMA, Journal of Ethics. Why crisis pregnancy centers are legal but unethical. What is this craziness that we are going on? Supporting pregnant women, unborn babies, children is unethical? No, members. It's a sad night. $17.5 billion surplus. You can't fund nursing homes, and now you're defunding crisis pregnancy centers. Grow up. Vote yes on the Scott amendment.
Discussion, Representative Scott.
Thank you, Madam Speaker. Members, as I said in my opening remarks, we're spending a lot of money. A lot of money's going to nonprofits this year. A lot of money that this side of the aisle, frankly, doesn't agree with. So here's a little crumb left over for moms that are needing help with the pregnancy that they may not have planned. And I'm puzzled because you claim to be the party of choice, except if that choice is to keep the child. These funds help people. These funds, in 2020, helped over 32,000 women. 32,000 women received resources, right? And what I was reading from originally was from the Minnesota Department of Health, the grant application, the grant information that's on their website. And you know what they do? They investigate grant recipients. Would Representative Olson yield for a question?
She will yield. Representative Scott.
Thank you, Madam Speaker. Representative Olson, I was puzzled by what you said about the budget issue, about the dollars and what this amendment would do. I didn't quite understand what you were getting at. If you would repeat that and walk us through again what you said about the dollars, please.
Representative Olson.
Thank you, Madam Speaker. So the A16 removes the repeal of the Positive Alternatives Program, and since the repeal of the Positive Alternative creates a savings in the bill, the amendment needs to account for the cost, which you know, otherwise I would be rising to a point of order around the cost. So what the amendment does to achieve this is by offsetting the DHS Central Office Operations General Fund base and the corresponding base rider on lines 536.25 and 537.31 through 32. So then the money is then added back into the Health Improvement Program base budget and corresponding base rider to reflect the current law funding for the positive alternatives at DHS. So I said an abbreviated version of that, but I hope that better clarifies how your amendment was drafted to be able to account for the cost.
Representative Scott.
Thank you, Madam Speaker, and thank you for that clarification, Representative Olson. I was unclear because usually if there's an issue with the dollars in an amendment, you stand for a point of order and call it out of order, and as it would upset the budget resolution, but that's not what this does. We pay for it. We just pay for it in a way that, I don't care how we tried to pay for this, you object to it. So the other side would. So members, this is foolishness to not fund a really good program that's been proven over the years. Just because there's an all-out attack on anyone that supports a woman that chooses to keep their child. Please vote green.
The clerk will take the roll on the amendment. The clerk will close the roll. There being 58 ayes and 67 nays, the motion does not prevail. The amendment is not adopted. There's an amendment at the desk. The clerk will report the amendment.
Damath moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A17.
The member from Stearns, Representative Damath.
Thank you, Madam Speaker. And members, the A17, let me explain a little bit of what that will do. This amendment would prohibit the dilation and extraction or partial birth abortion, except when necessary to save the life of the mother. It would prohibit third trimester abortion, except in instances of rape, incest, or the health of the mother. The bill would define the third trimester as a stage of pregnancy that begins at the end of the 26th week of pregnancy. And I'll tell you a little story. I have constituents that unexpectedly their baby was born early at 24 and a half weeks. She is now 4 years old, healthy, thriving, and her name is Willow. So when I look at the end of the 26th week, just keep in mind Willow, born at 24 and a half weeks, healthy and thriving. This amendment would also make crystal clear that women who seek or obtain an abortion would not be punished in any way, and we are very clear about this. This is not to punish the moms. This amendment would require the licensure of abortion facilities and also require the inspection of abortion facilities. And when we have talked with constituents around the state, it is an assumption that those abortion facilities are already licensed and inspected. But we let them know that they're not, and we are trying to help with that change to ensure safety for moms. This amendment would also clarify that an infant born alive following an attempted abortion must be treated as a person under the law and be issued a birth certificate. If that born alive infant would later die, a death certificate would be issued. This amendment would require abortion providers to notify parents of a minor if that minor received an abortion without parental consent, or if that minor received an abortion due to an emergency. So members, with that, I would ask for a roll call.
Representative Demuth requests a roll call. Seeing 15 hands, there will be a roll call. Representative Demuth.
Thank you, Madam Speaker, and I would encourage a green vote.
Discussion on the Demuth amendment. The member from Hennepin, Representative Katiza-Watun.
Thank you, Madam Speaker. Members, abortions aren't dangerous. This amendment isn't about making patients safer. It's about making access to reproductive health care harder. The underlying bill, Senate File 2995, does not repeal the existing parental notification statute, so there is no need for any additional reporting language as described in the A17, lines 1.3 through 1.24. The rest of the Demuth Amendment reintroduces out-of-date, medically inaccurate language and provisions that have been found unconstitutional. Because of that, these statutes are not currently being enforced here in Minnesota. Members, over the last 50 years, we saw it happen slowly. While speaking about the importance of small government and freedom, legislatures chipping away until our bodily autonomy was all but gone. Make no mistake, it happened through amendments like this, by adding unnecessary restrictions to all but render reproductive freedom impossible. And that's the case now in 14 other states. That is what this amendment is trying to do, and Minnesotans are paying attention. Minnesotans say, not here, not now. Members vote red.
Any further discussion on the amendment? The member from Crow Wing, Representative Davis.
Thank you, Madam Speaker. Members, we have an opportunity right here to do the right thing and undo what we've done. Everybody in this room has had the right to live. And I know I hear the terms you use, bodily autonomy, and we seem to be forgetting about the most precious bodily autonomy that there is, a baby. Well, I had my son here earlier today. Many of you saw him, and I thank you again, Madam Speaker, for allowing me to introduce him. He's 2.5 months old. When my wife was about 2 to 3 months along, I can't remember right in there, we had some testing done, some genetic testing, and when we got that testing back, we found out that Seth has trisomy 21. For those that don't know what that is, that's Down syndrome. My little guy that you saw here tonight. And the statistic I'm about to give you is not made up. It's true. In America, the United States of America, only 10% of babies like my son get to live. 90% of them, over 90%, I'm sorry, it's over 90% of them, their lives are taken while in the womb. I believe it's in Denmark. They brag that they've ended the problem of Down syndrome because they're, well, I digress. Folks, I am trying to appeal to your conscience tonight. I'm not trying to make this political. We all had the right to life. We had the right to live. And I would ask that you would support this amendment to undo what we've done. Every child formed in their mother's womb has a right to life. Please vote green.
Any further discussion? Representative Demuth.
Thank you, Madam Speaker. And would, Madam Speaker, would Representative Katiza-Watoon yield for a question?
She will. Representative Demuth.
Thank you, Madam Speaker. Representative Katiza-Watoon, you mentioned as you were encouraging a no vote, which I still am encouraging a green vote, you did mention that I have medically inaccurate wording in my amendment. Could you just point me to that? I'm not sure. I want to make sure that I have the correct information in my amendment.
Representative Katiza-Watoon.
Thank you, Madam Speaker. And Representative Demuth, there is a section here in your amendment. There we go. It starts line 5.14, discussing partial birth abortion, not how medical care works. It just doesn't happen. It's medically inaccurate.
Representative Demuth.
Thank you, Madam Speaker, and thank you for pointing me to the part that you were actually mentioning, Representative Katiza-Watoon. Members, I just want to correct that information. Dilation and extraction do happen. Rare, but they do happen. So as you take this vote this evening, just remember this is not medically inaccurate information. It may be a term, partial birth abortion, I know is a little bit of a hot button for members in this chamber. You don't like that term because it's a little graphic. And it's difficult to imagine, and it's difficult to hear. But rarely, it does happen. What we're trying to do with this amendment is we're trying to make sure that that doesn't happen. Now, we've given a lot of exceptions in my amendment, life of the mother, incest, or rape. We are giving outs on that, and we understand that. But members, I would encourage a green vote this evening. We want to make sure that those facilities are licensed and inspected. We want to make sure that moms are safe. And yes, we do want to protect the life of babies if they are born early in a failed abortion. Please vote green.
The clerk will take the roll on the amendment.
Coulter?
The clerk will close the roll. There being 59 ayes and 67 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Franzen moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A22.
The member from Douglas, Representative Franzen.
Thank you, members. Thank you, Madam Speaker, members. So this is a very simple amendment. I would hope that we could all vote green for this. The amendment before you, the 822 amendment, simply deletes the 20% increase that's in this bill that goes to abortion providers. Members, we just heard the Representative Scott amendment trying to claw back the defunding of the crisis pregnancy centers. And apparently, they're using that money to increase funding for abortion providers. I think that's irresponsible, inappropriate use of our tax dollars. And Madam Speaker, I would request a roll call.
Representative Franson requests a roll call. Seeing 15 hands, there will be a roll call. Discussion to the amendment. The member from Dakota, Representative Breyer.
Thank you, Madam Speaker. Thank you, Representative Franzen. So I recommend a no vote on this amendment. What the legislation actually does is provide a 20% rate increase for family planning services and reproductive care, which includes abortion services. Abortion services, reproductive health care, are health care, and deserve to be reimbursed at a rate that supports the providers who are making a living taking care of us. So for that reason, I request a no vote.
Any further discussion? The member from Stearns, Representative Demuth.
Thank you, Madam Speaker. And Madam Speaker, I request a call of the House.
Representative Demuth requests a call of the House. Seeing 10 hands, there will be a call of the House. The clerk will take the roll on the call. The clerk will close the roll. We are on the Franson amendment. And I believe that I had just recognized Representative Demuth, and she did a call of the House. Further recognition on the Demuth amendment, or on the Franson amendment.
Who?
Representative Demuth.
Thank you, Madam Speaker. Would Representative Richardson yield for a question?
She will yield. Representative Demuth.
Thank you, Madam Speaker. Representative Richardson, with the Franson amendment, could you tell me how much does Planned Parenthood stand to earn based on this rate increase?
Point of order, Madam Speaker.
Representative Long, please state your point.
Mason's Manual, Section 114, Paragraph 5. A question should not be permitted that reflects upon the character or conduct of any member. So this is asking a member about their individual character or conduct and not about the subject of the bill.
Representative Richardson, you may answer the question if you wish.
Thank you, Madam Speaker. Thank you, Representative Demuth, for the question. What I just want to share with what we're talking about tonight as it relates to reproductive health care, we need to understand what happens when we are restricting access to reproductive health care. In states with restrictive abortion laws,
Madam
in
Speaker,
a nation where
Madam Speaker, point of order.
Representative Scott, please state your point of order.
Maybe this is a point of parliamentary procedure, but what issue are we on? I think we're debating the A22, which has to do with increasing payments for abortion services.
We are on the A22 amendment. Representative Richardson.
Thank you, Madam Speaker. And, you know, as we're talking about this amendment and as we're talking about what's at stake, it's an understanding that in states that have passed restrictive abortion laws, we know in this nation that Black women are 3 to 4 times more likely to die from pregnancy-related causes.
Madam Speaker, point of order.
Representative Scott, she is speaking about the topic of the amendment. Please allow her to speak. Representative Richardson, you have the floor.
Thank you, Madam Speaker. I want to talk about the costs and the human costs that exist when we restrict access to abortion care. Black women are 3 to 4 times more likely to die from pregnancy-related causes in this nation. And in states that have restricted access to abortion care, it's even higher, as much as 20 times higher in states like Mississippi. So when we talk about the costs, we need to talk about the cost of human life and people who are dying, where 85% of those deaths are preventable. That's a cost that we are bearing as a state. That is a cost that we are bearing as a nation. Let's also talk about the cost of Black infant maternal mortality. Here in Minnesota, Black infants are twice as likely to die as white infants before their first birthday. And you can control for all of the factors: education of their parents, access to health care, access to housing. They are still more likely to die. But you know what actually disrupts that is when they have access to a Black pediatrician. So when we talk about the costs of action and we talk about the costs of inaction, we need to recognize that as a state, we have been failing Black families for centuries. The 14th Amendment guarantees that all persons born, and I will say that again, all persons born have a right to be protected by the laws of the United States. And we have not been protecting Black women. We have not been protecting Black infants. And when we recognize that the vast majority of maternal mortality and infant mortality deaths can be prevented, we should be doing better. So those are the costs that I want to talk about tonight and ensure that we are taking into account those human costs as well.
Representative Demuth.
Thank you, Madam Speaker, and thank you, Representative Richardson, for pointing those things out. Members, I want to draw your attention to a couple of things. As Representative Richardson just mentioned, the 14th Amendment guarantees that all persons born have a right to be protected. That would be those babies born on a botched abortion. They have a right to be protected by our laws, and that is fully what I expect that we would be supporting in this chamber and as an example to our state. Now let me help you with the details of the question that I asked, because I didn't quite hear for the body to understand the answer to the question, but under the Family Planning Special Projects Awards, in the Central Region, Planned Parenthood Minnesota, North Dakota, South Dakota Central, for a 2-year award is going to receive $805,000. Total 5-year award is going to be $2 million, over $2 million. I'm going to go ahead and move down to the metropolitan region. Planned Parenthood is going to receive $974,000, and I am rounding, not up, for a total 5-year award of $2.4 million. And I didn't have time to do the math to add these. These are individuals. Northeastern region, Planned Parenthood is going to receive $278,000 for a 5-year award of $697,000. Northwestern region, Planned Parenthood is going to receive $200,000 for a total 5-year award of $500,000. South Central region, Planned Parenthood will receive $271,000 for a 5-year award of $678,000. Southeastern region, Planned Parenthood is going to receive $148,000 for a total 5-year award of $370,000. Southwestern region is going to receive, Planned Parenthood is going to receive $173,000 for a total 5-year award of $434,000. West Central region, Planned Parenthood is going to receive $96,000 for a total 5-year award of $240,000. Members, we just had an amendment that would preserve the funding for crisis pregnancy centers that serve our Black, brown, Indigenous, people of color, and white families, and it was voted down. Yet in this chamber, it is okay to know what Planned Parenthood alone is going to be receiving. And that's not the top of it. That is the bottom. There is more. Members, I would ask that you would find Representative Franson's amendment something that you could vote for and support. I cannot believe in this state that we have funded grants for Feeding Our Future, hoping to feed those most in need, that were actually non-existent because of fraud. But you heard stats on this House floor of pregnancy centers around the state that are actually serving the most people in need. And members, I was a single mom for a while. I didn't access a crisis pregnancy center because I had family and a church family, Representative McDonald, that swooped in to help in my time of need. But trying to hide from what we are doing for the most vulnerable in our state, for women that are struggling to raise children and to meet their very basic needs, we have got to do better in this chamber for our state, and I would encourage a green vote on the Franson Amendment.
The clerk will take the roll on the amendment. The clerk will close the roll. There being 57 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Madam Speaker.
Franzen moves that Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A9.
Representative Long, for what purpose do you rise?
Madam Speaker, I move that the call of the House be lifted.
Representative Long moves that the call of the House be lifted. All those in favor, please say aye. Those opposed, please say no. The motion prevails. The call of the House is lifted. The member from Douglas, Representative Franson.
Thank you, Madam Speaker and members. So the A9 amendment, simple amendment here, it's the PROM Act. PROM Act stands for Protect Reproductive Organs of Minors. Members, recently I read an article, and the headline of the article, Age is a Number, Gender Clinic Offered Puberty Blockers to Kids as Young as 8, Surgery Referrals at 14, Records Show. This took place at the Children's Hospital of Pennsylvania. Also, members, I'm sure many of you have probably recently heard about something that just kind of broke recently, but it happened in 2016. And there was a medical article that documented a tragic death of one of the participants in what was called the Dutch study. And the Dutch study is upon which the entire child sex change experiment is based, and indicated that puberty suppression was to blame for the young person's death in this study. So the case was an 18-year-old trans-identified male whose puberty was blocked by Dutch researchers at a very early stage. So in this, there was not, because the child had started puberty blockers at a very, very young age, they were unable to develop normally. And so when the researchers and the doctors, or whatever you want to call them, was trying to create what they call a neo-vagina, a fake vagina for the male person, there was not enough penile tissue for the surgeons to use. And so they ended up having to use part of their colon. And the individual got very sick with a form of coli, and the individual died. And so I researched this article and found the study from, what was it? Not sure. Oh, a PubMed study. And lethal neocrotizing cellulitis caused by ESBL, producing E. coli, after laparoscopic intestinal vaginoplasty. So the study is there, this happened, and the puberty blockers were to blame for this. Members, adults can do what they want to do. This amendment simply speaks to children. That is it. Children need to be left alone. Children need to be able to be children. And they should not be on any form of puberty blockers, which sterilize, castrate children. It is irreversible. One cannot pause puberty. Anything contrary to that claim is a lie. So members, I'm asking you to vote in favor of the A9 amendment and to stand up and protect children. Thank you.
Representative Hollins.
Thank you, Madam Speaker. I would advise members to vote against this amendment. This is a dangerous and inaccurate amendment. So I've got 4 reasons why. The first one is, again, data from more than a dozen studies of young people has consistently shown that gender-affirming care is associated with better mental health outcomes, 60% lower odds of moderate or severe depression, and 73% lower odds of suicidality. And studies have shown repeatedly that lack of access to gender-affirming care is associated with higher rates of suicidality and self-harming behavior. It's really distressing for me that across this entire country, many states who claim to care about life and to care about freedom are so ready and willing to ban access to care that would provide for better mental health and protects the life of young people. Minnesota should absolutely not follow suit. Second, this amendment is medically inaccurate, and it bans procedures that are used in a variety of medical practices other than gender-affirming care. Hormone blockers are used to treat precocious puberty, fertility preservation during cancer treatments. Mastectomies are performed on teenagers who are diagnosed with breast cancer, and vasectomies are performed on kids with undescended testicles. And frankly, I'm a little upset that I have to even learn about these practices, but here we are talking about genitals once again. Third, I will say, third, our doctors take an oath of ethics and are good ethical people. They aren't performing these treatments in any sort of willy-nilly manner. You can't just get a procedure because you ask for a procedure, and we need to trust that our doctors are doing their jobs as medical professionals. And then my fourth reason, politicians shouldn't be involved in the medical decisions between trained medical professionals and patients. These are deeply personal choices that are being made, and they are being made behind closed doors. I think we all value privacy that is afforded to us, and especially when it comes to medical care. This is no different. The choices that are being made between medical professionals and patients should be just between those individuals, not between politicians sitting in a room somewhere deciding what's best for people. And for that, I am advocating a no vote. Thank you.
All those in favor of the amendment, please say aye.
Madam Speaker, roll call.
I'm sorry, I already called for the vote. All those in favor of the amendment, please say aye.
I still have the floor because I wasn't.
I had not recognized you. You did not stand. Anyone voting in favor of the amendment? Those opposed to the amendment, please say no. No. The motion does not prevail. The amendment is not adopted.
Division.
Madam Speaker,
Representative Dowd.
I'd move to have the previous vote reconsidered, and I did vote on the prevailing side.
Representative Dowd moves to have the previous vote reconsidered. Discussion. Representative Dowd.
She would like to have a roll call vote on that, and I think it's appropriate that we do that. So she was trying to be recognized, and apparently sometimes it's tough to see when you're looking over to the left. I think it's just considerate and appropriate that we would allow her to do that. So I would ask the members to vote and allow us to reconsider the vote.
Representative Dowd, did you request a roll call on your move to reconsider?
I am right now.
I thought you said so earlier. Representative Dowd requests a roll call. Seeing 15 hands, there will be a roll call. On the Dowd motion to reconsider the vote by which the A9 amendment was voted on. Representative O'Driscoll.
Thank you, Madam Speaker and members. Things were going very well this evening, and if we want to get into a parliamentary fight, vote against reconsidering and doing a roll call. You have that power.
Representative Robbins.
Thank you, Madam Speaker. I have a
parliamentary inquiry. I'm not sure it's correct to say it that way. I just have a question.
State your parliamentary inquiry.
Thank you, Madam Speaker. So I wasn't aware that we were supposed to vote aye when you called for the vote. I thought you were still discussing with Representative Franson. So were there any aye votes for the amendment? Did any one of us vote for it?
It did not appear that anyone voted aye, no.
So I think that's why we need to reconsider this vote, members, because people did intend to vote, and there was silence. We really weren't following what was going on. So I just encourage everyone to allow us to reconsider this vote. Thank you.
Any discussion? Any further discussion on the motion to reconsider? Representative Franson.
Yes, Madam Speaker, thank you. Okay, we're good.
Any further discussion? Representative O'Driscoll.
Madam Speaker, could you remind the body what a red and green vote on this would mean?
A green vote would reconsider the vote on the previous amendment. All those in favor, the clerk will take the roll. The clerk will close the roll. There being 117 ayes and 6 nays, the motion prevails. Representative Franson.
Thank you, Madam Speaker and members. And because we were so kind to reconsider, I am not going to belabor the speech. So if I could just get a roll call.
Representative Franson requests a roll call. Seeing 15 hands, there will be a roll call. Seeing no further discussion, the clerk will take the roll on the Franson amendment. The clerk will close the roll. There being 57 ayes and 68 nays, the motion does not prevail. The amendment is not adopted. There is an amendment at the desk. The clerk will report the amendment.
Perryman moves to amend Senate File Number 2995, the unofficial engrossment as amended. The amendment is coded A11-1.
The member from Stearns, Representative Perryman.
Thank you, Madam Chair. And let's not make any choice, but I'm asking for a roll call now.
Good strategy. Representative Perryman requests a roll call. Seeing 15 hands, there will be a roll call. Representative Perryman.
All right. Tonight, my amendment that I'm presenting seeks to retain guardrails on reporting data on abortions provided in Minnesota. Throughout session, the Health Committee, which I serve on, heard proposals that would increase reporting data for certain groups of individuals. Yet, this bill would remove the ability for our health department to collect and analyze data related to abortions. This amendment ensures that we can still collect and better understand data surrounding abortions, including information on abortion complications and how many infants survive an attempted abortion. Acknowledging that removing the reporting and data collection does make a small savings, I believe it's a small price to pay to ensure the Department of Health can continue to report on issues related to health. I'm also allowing MDH to retain their authority to license abortion facilities. Ensuring that the Minnesota Department of Health retains the ability to regulate abortion facilities is important and will allow them to implement reasonable rules to ensure women visiting these clinics receive safe care. My amendment also reverts the changes being made to the definition of abortion, which replaces the term pregnant woman with an individual with the intention of terminating a pregnancy. I'm concerned this really could potentially allow traffickers to accompany a pregnant woman to get an abortion with these words. The amendment returns the ability for women to seek civil remedies against the person that performed the abortion in knowing or reckless violation of statutes. Women need to be protected, and we shouldn't remove the ability for a woman to seek civil remedy if she chooses to do so. Madam Chair, I ask for a roll call, and members, I ask for a green vote.
Discussion on the Perryman Amendment. Representative Liebling.
Thank you, Madam Speaker and members. So we've had a lot of discussion tonight about abortion, and I think everybody pretty much knows where they stand on this. I'll just say a couple of things about this. First of all, I think we had some discussion before about the so-called Born Alive Infant Act, and Representative Perryman, thank you very much by the way, for your participation in the committee this year. It's been a pleasure to work with you and get to know you, and I hope that will continue. But we obviously disagree on this topic, and that's fine. You know, everybody can't agree on everything. But when you look at, you said that the infants, this gives us information on infants that survive an attempted abortion. That's actually not what it does. You know, the definition of a born-alive infant is not one who survives an abortion. What you're seeing in the data is infants who are, it says, and I don't have the definition in front of me, but it's even infants that are just born alive. It doesn't and have any sort of, and infants that are born that have any sort of sign of life and then die. It isn't really even related to having an abortion, because actually that just doesn't happen. It just doesn't happen. And so the data you're seeing really doesn't tell you that. I do want to explain about the change in the definition of abortion. So the definition that you're referring to, we made a change to it because when we looked at it closely, we realized that it doesn't actually include that the pregnancy was intentionally ended. I'm trying to find the actual definition here so I can give you the exact language. But if you look at it closely, that's why we made the change, because it says, it talks about ending a pregnancy, but it doesn't talk about ending it intentionally. And I think we would all agree that abortion is when you end the pregnancy intentionally, not when something happens by accident, right? So that's one of the things that you're removing here. But, you know, at the end of the day, we just disagree about abortion. And so I'm just going to ask, this amendment basically removes a lot of the repealers. It just keeps a lot of this language in law, that a lot of it is outdated, unconstitutional, and just infringes on the right to have an abortion. And I think that's all I need to say at this late hour. I'm just going to ask members to vote no.
Is there any further discussion on the amendment? The member from Anoka, Representative Scott.
Thank you, Madam Speaker. Would Representative Perryman yield to a question?
She will. Representative Scott.
Thank you. Representative Perryman, does your amendment speak to the repeal of the data provisions that are currently, the data on abortion care that are currently being collected now.
Representative Perryman.
Thank you, Madam Chair. Yes, and as Representative Liebling said over there, we're repealing a lot of the data collecting, and it's just going away, and I don't know why. We would not want to collect data to understand the health reasons as things go on, or just, you just need to know goods and bads, so what's bad, we can correct it by the data reporting.
Representative Scott.
Thank you, Madam Speaker. Well, I'm really curious because we just heard from Representative Richardson about the high mortality rates of black women and babies, and the only reason you find that out is by collecting data. So I'm a little bit, I'm just confused why we wouldn't want to continue to collect data that may lead to really important health policy decisions in this body. And to the constitutionality of it, of course, we know that in Dovey, Minnesota, that was decided this year, that is the reason for the primary reason for what was House File 91 that's in this broader omnibus bill. The judge found that the data collecting was not unconstitutional, and in fact, the reporting requirements on page 82 of the decision, it says that the reporting requirements do not infringe on a fundamental right. And also on page 82, it is stated that the reporting requirements take about 5 minutes. They're not burdensome. And I want to point out that a woman that's asked these questions doesn't have to answer the questions if she does not want to. On page 83 of the court decision, it's concluded that reporting laws do not violate the right to privacy or infringe on a pregnant woman's access to abortion care. So again, members, why would we not want to continue to collect this data that helps us inform decisions going forward? We say trust the doctors, trust all this, the medical community, but if we would have no way of knowing if we stop collecting this data, we would have no way of knowing the reasons why maybe women start passing away from abortions. We'll have no way of knowing and tracing that back to the source of those deaths. So this is really a common sense amendment. We need to continue the data reporting for sure. And Representative Perryman, thank you for bringing this amendment, and I encourage members to vote green.
Any further discussion? Representative Perryman.
Thank you, Madam Chair. I just think this is a great amendment. I really do, because it's just not, we're just going back to what we were doing. And the most important is, as Representative Scott said, is data is important to making decisions. A lot of the bills that we were proposing or looking at, and we're looking at in committees, that was one of the issues everyone asked for. We need data. We need to track things. We need to oversight or have oversight on things. And I don't know why this data would be so important to get rid of, so that we could continue to do better in the health care of mothers and women as they choose when they have to choose about abortion. So please, I ask the House to please vote green on this, and I really think you will be happy to do so, and it will be good for all our constituents. Thank you.
The clerk will take the roll on the amendment. The clerk will close the roll. There being 57 ayes and 69 nays, the motion does not prevail. The amendment is not adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, Senate File Number 2995, as amended.
Third reading as amended. Discussion to the bill. The member from Traverse, Representative Becker.
Thank you, Madam Speakers and members. The concern that we have on this side of the aisle is we want to make sure that all Minnesotans have access to health care. And the amendments that we brought up tonight would have improved access to health care. And that is our concern, especially in greater Minnesota with our hospitals, with seeing managed care being switched over to fee-for-service. Fee-for-service cannot pay for benefits outside of required Medicare. Also, fee-for-service cannot reimburse for non-medical services. We've heard members talk about that this evening. Quite concerned on how this is going to affect our critical care, our hospitals in greater Minnesota who are running at max 1 or 2% profit on a good day. And when we go to more of a government-ran program, that's one of the reasons we see like our service for our ambulance do fundraisers every year, because we're getting paid anywhere from 27% to 40%. So that means 27 cents on a dollar to 40% on a dollar. So again, members, our concern, we want to make sure that we have good health care access, and this bill doesn't do that. We heard from Representative Scott and Representative McDonald about positive alternatives, because again, health care access is important. And we need to support that from the conception of life to natural death. And what we're seeing in this bill here is we're not doing that. We had a spirited debate about the born alive. We have to support life. My volunteer profession and all my individuals who volunteer in not just EMS, but also in the hospitals, we are called to save lives. And we as a body need to do the same. So I do appreciate the author taking our First Amendment. Thank you. I really appreciate that. That alone, though, does not allow me to vote yes on this amendment, because I'm quite concerned in greater Minnesota we are going to see a decrease in health care access, because we're going to see hospitals closing down. We're going to see individuals driving even farther for their health care. So, members, thank you for your time. I will be voting no.
The member from Dakota, Representative Bierman.
Thank you, Madam Speaker. Thank you, members, for the long debate tonight and discussion. I really appreciated being part of this committee this year. It was a very good committee. I learned a lot, saw again the profound needs that we have across the state. There's not enough time or enough funding to address it all. The job and the challenges will not cease, but our objectives, as Representative Becker just stated, are about access, they're about affordability, they're about quality care for Minnesotans from every corner of this state, and that must remain our focus. This bill, members, moves Minnesota on the path towards a healthcare system which seeks to deliver needed care for every Minnesotan at a price they can afford. And I believe the members on this committee share that objective. We have a common cause in this chamber and much work to do. There's a lot of good bills in this omnibus, from the expanded medical assistance coverage in a variety of areas, preventative care where we need it, such as expanded continuous eligibility for children and youth, to tobacco and nicotine cessation treatment, to adult coverage for medically necessary services, and improvements to DHS work for support of the tribal healthcare system. Preventative care can reduce chronic conditions and save longer-term medical costs. I also particularly like the expanded diagnostic mammogram screening service carried by Rep. Acom, the Minnesota buy-in carried by Majority Leader Long, the Nurses by the Bedside Act, the network adequacy expanded parameters from Rep. Kraft, the lead remediation by Rep. Jordan and Rep. Howard, and the competitive statewide grants to expand school-based health clinics. Affordability, access, quality care. These are the imperative goals. But better health outcomes, better health and longer lives are the ultimate goal for Minnesotans in every county of Minnesota. And I look forward to continuing this work with all of you. Thank you, Madam Chair.
The member from Rock, Representative Schumacher.
Thank you, Madam Speaker and members. In addition to what others have said tonight and the amendments that we offered, I'm going to encourage a no vote on this bill. We talked about the abortion policies, and as one member pointed out to me, there's more money this year for expanding abortion options than there is for expanding nursing home options in this legislature. And that's a terrible precedent to set. But in addition to that piece of this bill, we also have a bill here that adds excessive mandates onto hospitals and erodes our stabilized health insurance marketplace. We tried to pull those hospital staffing mandates out in this bill, but voting yes on this bill will include several mandates with several new requirements on these hospitals. As we talked about before, and those new mandates include a new mandate for a staffing committee, a new mandated workload committee, a new mandated requiring the maximum number of patients for an RN to be assigned, a new mandate shifting staffing decisions outside of hospitals through arbitration, a new mandate to post these staffing mandates, and a new mandate to be graded by MDH with no context, like if a hospital offers mental health services. This proposal adds mandates to hospitals, challenging their ability to keep their wings and their stations open and depriving access to health care. This bill also erodes our stabilized health insurance marketplace by eliminating the managed care, a system that at least 40 states have adopted and more are moving to. And you may ask yourself why they're doing this. Well, according to a 2019 study from CMS, compared to the fee-for-service system, which Minnesotans through this bill will be able to either opt into or have no choice to go to soon, managed care can allow for greater accountability for outcomes and can better support systematic efforts to measure, report, and monitor performance, access, and quality. In addition, managed care programs may provide an opportunity for improved care management and care coordination. 40 years ago, Minnesota was a fee-for-service state, and we moved from that because providers were refusing to see Medicaid patients. Yet that's the system we're moving back to when you vote for this bill. Managed care benefits consumers, it benefits providers, and it benefits the state. Managed care offers care coordination, lowering the probability of hospitalization. It helps their members age in place and stay out of nursing homes. It connects members with resources like transportation and homemaking. They have incentives to provide coordination and lower the cost of their care. Managed care is paid with a capitated rate, which helps our state budget. There's protections for taxpayers, 85% of the medical loss ratio. If they spend more than the state pays in capitation rates, managed care has to eat the cost. But if they spend less than 85%, they have to pay back the difference to the state. Managed care goes beyond the mandated benefits with dental and other things like car seats. That sounds like a good deal, right? Which means we probably should scrap it and go to that fee-for-service model, which can't be budgeted for, which benefits from increasing volumes of work and stays in the benefit set that is set in law. The budget spreadsheet shows a $96.456 million savings by eliminating managed care, but there's no fiscal note to support that number. But we know for sure that eliminating managed care does require the state to pay back the 8% performance withhold, which is $84 million in costs. This bill offers more questions than answers, and it disrupts a stabilized health insurance marketplace. I would like to take a moment to thank Representative Liebling and for her work this year and congratulate her on getting this bill with her team to this point. I was doing the math a little bit ago, and Representative Liebling, this is our 7th year working as chair and lead together. Wow. That has to be a record. That's all I really have. Thank you, Madam Chair and members, for the discussion, and please vote no.
The member from Olmsted, Representative Liebling.
Madam Speaker and members, thank you for the very respectful debate. I would appreciate a green vote on the bill.
The member from Hennepin, the Majority Leader, Representative Long.
Thank you, Madam Speaker. All Minnesotans deserve affordable, high-quality health care no matter your zip code, income, or background, but we know too many Minnesotans still struggle with access to care and with affordability to care. That's why our health care budget takes significant steps to reduce the cost of health care. And I am proud to be the lead author of the Minnesota Care Public Option proposal that is included in this bill. A doctor testified in committee that she had an insured patient who delayed treatment because of high deductibles, leading to him tragically.
Members, please take your conversations off of the House floor. Representative Long.
Had an insured patient who delayed treatment because of high deductibles, leading to him tragically dying of cancer. Minnesotans need access to care they can afford and use, and more than 100,000 Minnesotans currently count on Minnesota Care. We know that many more would participate if we broadened access beyond current income thresholds. We also expand access to Minnesota Care for our undocumented neighbors who currently only have access to emergency care. We significantly invest in behavioral health. We include the Keeping Nurses in the Bedside Act to help protect nurses and patients from dangerous understaffing situations. We put in place important requirements for healthcare mergers, giving agencies in the Attorney General's office additional tools to make sure that healthcare mergers are in the public interest. And we increase funding for reproductive health care, funds for family planning, and repeal the harmful anti-abortion language. We are taking a firm stand on access to reproductive care and privacy. Members, please vote green.
The clerk will take the roll on the bill. The clerk will close the roll. There being 69 ayes and 58 nays, the bill is passed and its title agreed to. Messages from the Senate.
Message from the Senate, Madam Speaker. I hereby announce the passage by the Senate of the following Senate file, herewith transmitted. Senate file numbers 1384 and 2369.
First reading of Senate files.
First reading Senate file number 1384, an act relating to state government. Nelson M. moved that Senate file number 1384 and House file number 1522, now on the General Register, be referred to the Chief Clerk for comparison.
Without objection, so ordered.
First reading Senate file number 2369, an act relating to economic development. Hassan moved that Senate file 2369 and House file number 1922, now on the General Register, be referred to the Chief Clerk for comparison.
Without objection, so ordered. Motions and resolutions. There's copies of the non-controversial motions at the House desk and online. If there's no objection, we will take action on these motions first. Hearing no objection, the motions prevail. Announcement by the Speaker.
Announcement by the Speaker. The Speaker announces the appointment of the following members of the House to a conference committee on Senate File Number 3035. Hassan, Zhang, Nelson M., Berg, and Olson L.
Announcements. Representative Long.
Madam Speaker, I move that when the House adjourns today, it adjourns until 11 a.m. Thursday, April 27th, 2023.
Representative Long moves that when the House adjourns today, it adjourns until 11 a.m. Thursday, April 26, 2023. All those in favor, please say aye.
Aye.
Those opposed, please say no. The motion prevails. Representative Long.
Madam Speaker, I move that the House do now adjourn.
Representative Long moves that the House do now adjourn. All those in favor, please say aye. Those opposed, please say no. The motion prevails. The House stands adjourned until 11 a.m. Thursday, April 26, 2023.